it can be screened. And through nutrition, lifestyle, breathing, and other changes, one can actually prevent this disease. Now, why is it important to understand this? It is important because in olden times, very few people had cancer. But today, the cancer is rising very fast in all over the world. And by the time the signs and symptoms come, cancer has already occurred in the body, and then it's either it's surgery or it's radiation, but the cancer cells have started forming or destroying tissues in the body. So today, I'm very excited to be hosting this session where you will be meeting top doctors in oncology. The first doctor would be somebody who has worked in cancer treatment, worked with cancer patients, but decided to set up screening systems for cancer so that very early it could be identified, and through nutrition, lifestyle, and other changes, you could actually save your life and not end up with cancer. We also have dietitians. We also have top pathologists who have spent more than 20 years in this field. We also have yoga experts who will tell you how breathing can help you in bringing oxygen and creating an environment where cancer cells are not able to multiply. We have behavioral psychologists who will tell you how stress is connected to lifestyle disorders, and of course, nutrition management of cancer. So first, I would like to say that all of you who are joining in today will find this session very unique because doctors from allopathy, Ayurveda, nutritionists, psychologists, and yoga and breathing experts for the first time have come on a single panel. So it is a 360 complete view of cancer prevention, which I as a doctor have not really seen before in any other panel. So this is an amazing panel. Every doctor is dedicated to ensuring that patients do not end up with serious disease and have to have major surgeries to even survive. So it's my pleasure to be inviting my first panelist. Kanika, may I request you to put up the slide? My first panelist is the renowned doctor, Dr. Gurdeep Singh Sethi. Dr. Gurdeep Singh Sethi is a medical oncologist and a hematologist. He's an MD and a triple American board certified medical oncologist. Now, triple American board certified medical oncologist is a very prestigious achievement for any oncologist and has over 36 years of experience in cancer management and immuno-oncology, which is how immune cells work in oncology, including 26 years of practice in USA and over 10 years of practice in India. He would be talking about importance of cancer screening. So may I invite Dr. Gurdeep Singh Sethi to come over on the seminar and help our audience to understand cancer and not to be scared of cancer, but on the contrary, to understand cancer in a way where you can protect yourself. So Kanika, may I request you to pin Dr. Sethi's screen and put the spotlight. So Dr. Sethi, it's a pleasure. Thank you for coming in and thank you for agreeing to be, the celebrated doctor for this session.
I don't know about the celebrated, but thank you, Shikha, for the kind introduction. Yeah. And there's a lot to talk about. And this is a whole cancer processing holistic approach we're going to talk about today. So what I'd like to do is, if you allow me, I'm going to share a 1-minute video clip and then go through some slides which I prepared to get this message out to everybody on cancer is happening. We just need to catch it early and cure it and not be scared of it. That's about it. It's something we can deal with like every other disease. And how we can prevent it, how we can catch it early and move on in life and lead a normal life. And not to be scared of that word, cancer. So I'd like to project this slide on. Who's helping us? Kanika?
Yes. So, yes, you have the.
Please give us a second. We are just displaying your slides.
Okay, so I just want this video played first. Just let me know when we're ready. Now I'm going to play this video. Are we on?
Every year, more than 14 lakh people.
Request for screen share?
Yeah.
Share. Okay. All right.
Share.
All right. Is the screen on? Can you see the screen now?
Yes, the screen is visible.
All right. Here we go.
Every year, more than 14 lakh people in India develop cancer. As per Globocon 2020, there will be a 25% increase in cancer cases for top 5 cancers in males and females by 2030. Cancer occurs when changes in a group of normal cells within the body lead to an uncontrolled abnormal growth, forming a lump called a tumor. If left undetected, tumors can grow and spread to other parts of the body, thereby becoming life-threatening. The best cure for cancer is to detect silently growing tumors before they become dangerous. This is now possible with Pantum Detect blood test. Pantum Detect blood test, brought to India by Medidect through a revolutionary EDIM technology. EDIM technology screens immune cells called macrophages from a healthy individual's blood sample for the presence of 2 biomarkers. The biomarkers, APO10 and TKTL1, give an indication of silently growing tumors across all stages of tumor development. Cancer Scan program leverages available imaging techniques for multi-cancer screening of healthy individuals. The Cancer Scan program uses Pantum Detect as a filter blood test to isolate at-risk asymptomatic healthy individuals for whom a follow-up cancer diagnostics is prescribed to locate the spread of tumors. Annual participation in our multi-cancer screening program, Cancer Scan, increases the probability of detecting silently growing tumors before the onset of symptoms. It helps in timely preventive measures against tumors and cancers. To book a test, visit the link given here, or call the phone numbers mentioned. Thank you and have a good day.
So that's a minute, just a short clip that's been there. And now I'll go through the process of talking about the cancer prevention program. So let's start with here. Okay. Am I sharing? Can you guys see me on this? Oh, share. Okay. And where's that? Desktop. Okay. Share. Which one are we sharing? Not this one.
Sir, shall we display the slides?
I'll share. Yes, we're going to share the slide.
Okay,
am I on? Can you see the screen now?
Yes, please. It's visible.
Okay. Visible. It's a full screen now, right? Yeah. Okay. Here we go. So going through this, I'm just going to make sure I'm okay. Now I can see everything clearly. So we all know that cancer is a disease in which one or more of the body cells can grow uncontrollably. And this happens when there's a genetic mutation. And it can develop anywhere in the body. So there are over 200 different types of cancers in the human being. Okay. So if we look at the whole process, where is this? Next slide. Okay. So there are over 200 types of cancers. The local cancers, the tumors are called benign. And when they start spreading to other places, when they become more aggressive, they're malignant. Most cancers are solid organ cancers, which is 92% of all the cancers. And the leukemias and lymphomas are 8%. And the most common cancers in India, we all know, is breast, cervical, and head and neck cancer. Right. So there are generally no symptoms for early stage, and most symptoms are vague. You can have mild abdominal pain, weight loss, low-grade fever, very vague symptoms. Most symptoms only come in the late stage. That's when the patient comes to you. So we want to be able to catch things early, and that's what we're working on. Sorry. So these are early symptoms: change in bowel habits, lesion that does not heal, unusual bleeding, indigestion, voice change, unexplained weight loss. These are general symptoms early. So what is the reality of cancer in India? We are seeing so much cancer, so much cancer. Only 1.5 million was the incidence last year. And we think every house has cancer. The truth is, WHO says 1 in 10 Indians will have cancer in their lifetime. That means 150 million. We're seeing 1.5 million, 1% of the problem. So the problem is much, much, much larger than what we know. ICMR says, nope, WHO, you're wrong. It'll be 1 in 9. That's 180 million people, even more. So this is the Globocon data that we have from 2022, 1.4 million new cases, out of which 1 million died that year. And the prevalence is around 3.5 million, with an expectation of 25% increase in the next 3 years. We're already there because we're detecting more. If you look at this, there's for screening out of the 200 type of cancers, we only have screening available for 6 different types of cancers. Okay. And if you look at the pie chart here, 25% cancers are breast and cervical, right, which we are able to screen. Colonoscopy for pulmonary cancer, PSA, skin cancer, head and neck, dental examination. So 30% of the cancers we can screen for, but we don't do that. Nobody goes for screening. 70% of the other cancers, we don't have a solution. Okay. So there's always delay in symptoms because we don't have screening process. And most people land in late stage where it's life-threatening, and the cost goes sky high. All right. Most people present here, late stage, where the cost of treatment goes to 20 to 50 lakhs, and survival is less than 15%. We want people to come here in the early section where so we want people to come in the earlier stage, stage 1, if they have cancer. If we catch it, the cost of treatment maximum is 2 lakhs, and there's a 95% cure rate. So if you look at what are the risk factors for cancer, we've identified risk factors which we can do something about, and there are risk factors that we don't have control over. Tobacco, number 1 cause of cancer, 12 different cancers. Tobacco in every form, whether you chew it, you smoke it, you smell it, you do secondhand smoking, all come in there. Obesity is catching up with tobacco in the Western world, 12 different cancers, and in North India too. We're all becoming obese, Punjabis. We just eat and sit, and we get fat, and we have more risk of cancer. We've gone from regular food to processed foods. Ziggy, Zomato, home delivery. High risk for cancer with processed food. Alcohol is catching up, 7 different cancers. And then we sit all day. Okay. If traffic is so bad, to go to a place, 3 hours going, 3 hours coming, 6 hours gone. So we are physically inactive. And if you have unfortunate HIV or hepatitis or certain infections which increase risk, this we know we can deal with. All these factors can lead to diabetes, and diabetes causes inflammation and higher risk for cancer. If you're exposed to certain toxins, chemicals working in factories and all that, those increase risk. So these are risks that we can do something about. And then there's a group of risks which we can do nothing about. If I have a genetic risk from a family history already, or there's a strong family history, or if I'm sitting in Delhi and I cannot move to Switzerland, the environment, I'm smoking a pack a day, that I can do nothing about. But at least the other 8 modalities I can do something about. So we've developed, and if you look at all those risk factors cause these 40 types of cancers. So we've developed a multi-cancer risk assessment questionnaire where all these factors are addressed and you go through it and an answer comes up right away. This is a multi-cancer risk exposure report that comes to you. You'll go through all the questionnaires and it'll tell you whether you're low risk, medium, or high. So you even have one red tick, you're already at high risk. If you have multiple red ticks, you're very high risk. Then we recommend you to go for further screening and testing. So this is a simple questionnaire we've developed. All right. So we want to detect cancer early so that we can prevent it from getting to late stage and cure it. The whole goal is to catch it early. This is your UK data saying that if you're stage 1, you're 90% cured, 5 years. And if you're stage 3, 50% cured. Stage 4 is 15%, we don't want to talk about. US SEER data, all cancers, early stage, 90% cured. Lung cancer, 60%. But late stage, all cancers, 20%, lung cancers, 5%. Similar data, 2 different continents giving the same answer. We're seeing the same here in every country. All right. So, and 85% of the deaths are happening in those cancers where we don't have screening technology. That's the other 150, 180 cancers, 182 cancers where we don't have screening. 85% of the cancers. 15% are happening in those 5-6 categories which we can screen for. So cancer is caused by a genetic, lifestyle, and environmental factors. It's not only genetic. Genetic cancers are only 5 to 10%. 90% are somatic, lifestyle, and environmental factors. And this can be prevented by modifying lifestyle, changing your diet, avoid tobacco, avoid alcohol, okay, or cutting it down, and getting active. Eat good food, modify your diet, increase physical activity, and get regular screening done. There's American Cancer Guidelines for mammograms, pap smears, CT of the lung if you're a smoker, colonoscopies, PSA check with dental exam, oral dental exam. Those guidelines are there. I'm not going to be talking about that, but those you need to do. And on top of that, we recommend to do a phantom blood test, which is a simple blood test you do once a year. Okay. It's a multi-tumor screening blood test that filters asymptomatic healthy people, you and me. We have no symptoms. And we do this test, and if we are positive, we may have a pre-malignant or malignant tumor in our body. So it screens for that. All right. And it's a German company that developed this, Zyagnom. That's a mothership. And they have partnered with us in India to bring this technology to India. All right. So it is a screening for healthy individuals. The best cure for cancer is to detect it early before they become dangerous. Cut it out, cure. No chemo, no radiation, nothing is needed, very early stage. Just cut, cure. But we have to screen. We have to be able to detect it. And how does Phantom work? Pan-tumor, Pan-tum detect. It detects 2 biomarkers, apotin and TKTL1. Okay. These are 2 biomarkers which are present in the pathophysiology of all solid tumors. The 192 type of cancers that we have, they have used the same technology and same pathway. And the tests based on Zyagnom's proprietary of EDIM technology, where we look at the epitopes detected in macrophages, your immune cells. Okay. So talking about the biomarkers, DNase X endonuclease protein, which gets mutated. Endonuclease is responsible for cleaving the chromosomes of the cells when they get old and die. But because of the mutation in there, these endonuclease are unable to cleave the chromosomes, so the cells don't die. Then the body makes more and more of this inactive DNase X. So this apotin number goes up. If your apotin is high, you have a benign tumor. Cells are not multiplying, they're just not dying. They start collecting. And the next protein is TKTL1, which Dr. Savante Pabo got a Nobel Prize for, talking about its properties. This was discovered by Johannes Coy in 1995. And this is the same protein we'll be talking about next. So TKTL1, transketolase-like 1 protein, indicates the switch towards malignancy. It transforms the metabolism of energy in cancer cells. Normal cells use glucose and oxygen, Krebs cycle in the mitochondria to produce ATP, energy. Cancer cells use glucose and ferment it because of TKTL1. There's a Warburg effect, and they use a PPP pathway resulting in lactic acid and pyruvic acid production, which breaks down the matrix and helps it spread. And this is seen in all cancers. So the EDM technology, your macrophages, your white blood cells, your fighter cells, they're the ones that leave your blood cells, go see a tumor. If there's a tumor out there of any type, it takes some of the cells from the periphery, comes back into the blood cells, come back to the blood. We take your blood, we separate the macrophage, we stain those TKT and apoTen intracellularly with special fluorescent biomarkers, and then run it through a flow cytometry machine. So the flow cytometer analysis of asymptomatic healthy individuals of a blood sample for the presence of tumor biomarkers. That's all we need. Just one wire can make a difference. And it detects all types of solid tumors. And we've got over actually 12,000 now with 320,000 tests done. And over 30,000 recurring customers in Germany already where they're through insurance. The sensitivity of the test is 97% with specificity of 99%. It's an yearly test. You do once a year. So carcinoma in situ is stage 0. And then stage 1 comes in where there's degeneration of matrix and early spreading. That's when you turn positive. If I can catch you here, I'll do a scan, I'll find a small tumor, I cut it out, you're cured. This test does not tell me what type of tumor you have, does not tell me where the tumor is. Just tells me there's a tumor in the body. It's a basic screening test, simple blood test. If your immune system is off, the macrophage, if you're on active autoimmune treatment for Crohn's or rheumatoid arthritis with either methotrexate or immunosuppressant cyclosporins, all these immune suppressant drugs, or if you've had cancer and non-active treatment, you have to wait for 1 year. If you had any infection or vaccinations, we wait for a month, let your immune system reset. You have to be cancer-free for 1 year on no active cancer treatment. Then you're eligible for this test. 99% of the population are eligible. 1% have the other problem. And this is how your results come. So it's a Bantam score. And score above 260 is positive, less than 260 is negative. This is how it is explained. Okay. We look at the apoTen score. It has to be above 140. That's a tumor is formed. And the TKTL1 then adds up to above 260. If you're less than 260, you don't have cancer. But if you're 255, 258, that means you have some risk factors. You meet with your doctor, you go through the risk factors. The doctor will advise you cut down alcohol, cut down smoking, lose weight, get active. We retest you in 3 to 6 months. So I'm 258. I might be worried. 260 is my cutoff. I'll try to go through those programs to get me healthy and retest in 3. If my numbers are coming down, then you know that it is not cancer, it's those risk factors. But if it still remains 258, 259, 260, then after 2 times, I'll scan. I won't wait for a year. I won't wait for you to go positive. If you are positive, then you go to your doctor who will recommend some blood tests and a PET scan. And here's a guideline for our doctors too. Just some blood tests, CBC and definitely PSA in a male, and the creatinine. So then we can do a PET scan or PSMA PET or an MRI. And then based on where the location is, we do a biopsy, we get the histopathology, then you get your treatment as per your oncologist or your hospital team. This is a cancer scan program. It filters out. It's a filter blood test for the healthy population. Only those who test positive goes for further scan. The rest come back after 1 year. right? I'll go quick. There are a lot of technologies that are coming out. That we have NGS, we have CTC scan, we have HRCs. All these are competition coming up, but they're not where we are, and they're much, much more expensive. And sensitivity and specificity is way lesser. Okay, this is the cost difference. So, and we have a lot of scientific proof. Okay, it's one blood test for 92% of all cancers, all solid tumors. It's a game-changing full body screen, and it's keeping India one step ahead of cancer. It'll save lives and livelihoods, okay, and expand treatment options for improving chances of cure. Who is it for? It's for anybody who has an active, healthy lifestyle and believes in preventive healthcare. Preventive healthcare. It's for people who have family history of cancer or who are exposed to toxins and chemicals. And it's also for people who go for the annual checkup and you want to do that. And this is added to that program. It also goes to all your corporates and CSRs and government farm programs, all that come later. But this is for all of us first. Simple blood test, looking at apotin and TKTL1 in whole blood. We take one CBC tube, EDTA tube, and we run a test accordingly, right? We have got over 25 years of experience, over 60 publications. And these were the two main studies we want to talk about. One is the IVD-CE, where they got the European approval. They took 277 cancer patients, newly diagnosed, 270 tested positive, sensitivity being 97.5%. They took 735 healthy people, 7 tested false positive, making a specificity of 99%. These 7 people were followed for 1 year, and in the second year, 4 of them were found to have early cancer. So this number is even more higher. In India, we had to do the studies for the DCGI and Government of India to get approvals and do the revalidation tests. We took 180 cancer patients from Guru Ramdas Hospital and Max, newly diagnosed, blind, came to us, cancer patients and healthy samples. We had 179 out of 180 that tested positive, and the younger in this healthy population, all 180 were negative, no cancer. So this is the data we have. In Germany, they did a post-marketing study where the insurance company wanted to do a study. They took 5,000 healthy people, out of which 186 tested positive, which was 3.6%. Otherwise, in their population, it's around 1.5% that present with cancer. So this went up by 2%. Out of that 186, 151 wanted to agreed for the PET scan, in which, if you look at it, 94% were found to have tumors, 71 were malignant, 23% were benign tumors, and 6% were false positive. And this included over 40 different types, 32 different locations, and all early stage. Talking about other study presentations, in the University of Tübingen in Germany, they did 7 studies over 10 years, 652 patients, different type of cancers, 8 different types of cancers. Overall sensitivity was 96%, specificity 98%, and these were 8 different cancers. All these publications are here. We have all the publications, right? All listed up here. So carry home point is cancer is life-limiting and threatening if they come in late stages. Very taxing, very costly, destroys family, destroys patient, destroys livelihood. So there's a need for prevention and early detection. You can prevent it by stopping the risk factors, smoking, tobacco, alcohol, processed food. Get active, regular exercise, maintain a proper BMI, less than 30 definitely, ideal less than 25, and get your regular testing done, your mammogram, your pap smears, which are recommended by ACS, and also get a phantom test done once a year. It's a screening test that can identify that you don't have a problem, which is good. You screen 3-4 years negative, likelihood of cancer is another 5 years, you won't have anything. So that's the beauty of it. And if it's positive, the person will need further testing, imaging, and biopsy. Thank you. Thank you for your time. Anika, thank you.
Thank you, Dr. Sethi. That was really, I think, very well structured in terms of, the entire thing about that we can save our lives because there are possibilities of early screening and catching it, and it's only an annual test. So one annual test and we can be protected once we do the test, we can do the modifications in our diet and lifestyle. So that's amazing. And thank God for that such technology is available today, that people can actually benefit from early screening. So I would recommend all of you that we would be sharing the details of all our speakers. And some of you who are interested to get this test done, please do reach out to us and we'll be happy to help you. There are some questions. So after the next speaker, we'll be putting the questions out to the doctor. So I'll request Dr. Sethi to stay on till the next speaker. And after that, we'll be having some more questions. And now it's my pleasure to invite Dr. Anshuman Kumar. And Kanika, if I can request you to put out the slide. Dr. Anshuman Kumar is the Director of Surgical Oncology. He has more than 2 decades of experience and unparalleled expertise. He has done his MBBS and MS in surgery, and then MCH in surgical oncology, MRCS, and he has also a deep interest in yoga, besides the fact that he also understands administration, and that's no wonder that he's such a renowned doctor in India. He's a leading authority in this field, committed to providing exceptional surgical care and advancing cancer treatment. One thing which I can say, which is not there in his resume, is that Dr. Anshuman Kumar is a wonderful scientist, wonderful doctor, but he's also somebody who is studying Vedas from a point of view of health. And his understanding of health and Vedas and our traditional knowledge is, I would say, amazing, because I have yet to find somebody who has a deep interest in both sides of healthcare, the cutting edge modern science and as well as our ancient wisdom. So it's my pleasure and delight to welcome Dr. Anshuman. So may I invite Dr. Anshuman?
Yeah, thank you, Dr. Shikha. And Kanika has taken tremendous effort to bring this conclave on ground reality today. And really, this is a bridging gap between, you can say, modern science, understanding of the nutrition, and all the kind of holistic care. That's the reason I started. And I'd like to share my presentation. Yes. Is it visible now?
Not yet. I mean, you are visible. You are visible, doctor.
No, the screen is not shareable.
No, your presentation is not visible. So in case Kanika has it, then I can ask Kanika to share the presentation. She has the sharing rights also.
No, ma'am, I don't have the sir's presentation.
Okay, no problem. So if you would like to share with me, I can share it. Kanika, can you just WhatsApp?
Okay.
Yeah, Kanika, can you WhatsApp your email ID to sir also?
Sure, ma'am.
So while the president,
Kanika, just allow me from.
so I would like to tell everyone that Dr. Anshuman and I have been on various television channels together. And what always surprised me about Dr. Anshuman was that while on we have been on Z, we have been on Sahara, we have been on NDTV, we have been on CNBC. So what amazed me about Dr. Anshuman was that Dr. Anshuman always spoke about prevention, even though he's a surgical oncologist. He does surgeries. But he always spoke about prevention, and his depth about understanding nutrition actually, I think, beats me also, because his understanding about nutrition comes at a cellular level, and his understanding about food in context of health was amazing. And that's why I requested doctor to not only talk about the allopathic aspects but also talk about the ancient sciences and the nutrition. So yes, we can see the presentation, doctor.
Okay, perfect. Thank you so much, and sorry for the delay.
Not at all,
Thank you,
not
Dr.
at all.
Shikha. Really, it's a pleasure to be with you on Oncology Conclave. And that's the reason I started topic with integrative oncology. Although this word is new for our country or Southeast Asian country, but now China, Europe, and American, they started considering this integrative oncology as a newer concept, considering everything. And people must be surprised in the era of a digital world, especially ChatGPT can give you all the information. Why Dr. Shikha has planned this kind of online webinar or conclave? हमारे शास्त्रों में लिखा है विद्या मित्रम प्रवासेषु भार्या मित्रम गृहेषु व्याधि तो औषधम मित्रम धर्मो मित्रम मृतस्य च। अगर आप बाहर हैं जहाँ 2G 3G काम नहीं करेगा, विद्या जो आपके जहन में बात उतर गई है, यही मित्र है। चाणक्य ने कहा था पुस्तकेषु चय विद्या परहस्तेषु यथा धनम उत्पन्नेषु च कार्येषु न स विद्या नाता धनम। मतलब पुस्तक में रखी विद्या और दूसरे के हाथ में गया धन, जरूरत पड़ने पे कभी काम नहीं आएगा। इसलिए जो आपके जहन में है, 2G 3G हो ना हो, आप उसका इस्तेमाल कर सकते हैं। When we talk about the integrative medicine, there are a lot of chaos, confusion, clutter. The reason being, people very loosely start using the term alternative medicine, but we have to clear it. What is alternative medicine? What's complementary medicine, which is not the integrative medicine? Alternative medicine are all those therapy not taught in conventional medical school. Means Dr. Shikha is also MBBS, Dr. Gurdeep Shetty is also MBBS, I am also MBBS. What we were not taught in our conventional teaching, which comes under alternative medicine and complementary medicine, adjunctive therapy added as after major conventional treatment, like support system or anything, that is complementary medicine. But when we talk about this, especially in today era, when we talk about any alternative medicine, people started thinking that it's an emotional pendulum. Means only diet correction, only yoga, only naturopath can cure cancer. Another side of the pendulum, ego side of the pendulum, we as a modern medicine doctor, we think nothing can work. There's another side of the pendulum. Therefore, we have to come to a common point, balance the two of the things, knowing both the part of the system. And that answer is available only with the integrative medicine, which includes idea and thought beyond the scope of conventional allopathic medicine, which neither rejects conventional therapy nor accept alternative uncritically. There are 4 principles of integrative medicine. That is the natural healing power of the organism, whole person medicine, importance of lifestyle, and critical role of doctor-patient relationship, which we all agree that today we are feeding this concept. People are surprised, as Dr. Shikha rightly said, I'm a cancer surgeon. Then why we are talking about the prevention and going outside the operation theater and working in the public? The doctor means the actual word doctor was derived from Latin word dossier. The actual meaning of doctor was teacher, shikshak tha. Today, role reversal of doctor has been there because of corporatization of the healthcare system. When we talk about the healthcare system, the first word is health, swasthya. Our modern medicine describes not mere absence of disease, but physical, mental, and social well-being is a complete health package. In Ayurveda, Sushrut Samhita, सूत्र 15 10वें अध्याय में है समदोषा समग्निसा समधातु मलह क्रिया प्रसन्नात्मेन्द्रिय मनः स्वस्थ इति अभिधीयते, मतलब सारी चीजों की सम अवस्था में हो जाना ही स्वास्थ्य है। स्व स्थिते इति स्वास्थ्य, अगर इसको कर देंगे तो कोई भी बीमारी, चाहे कैंसर ही क्यों ना हो, ये आपके सामने नहीं आएगी। When we talk about the health, there are two concepts. Lifespan means date of birth, when a child was born till the last date, it is lifespan. Health span, out of that lifespan, how many years that person remains without disease or without pills, means life without pills, completely healthy, swasthite, that is health span. Our aim should be, health span should be equal to the lifespan, means life without pills. These are the common diseases which we consider disease. This is जीवन शैली संबंधित बीमारियां, लाइफस्टाइल रिलेटेड डिसऑर्डर, हाइपरटेंशन, डायबिटीज, डिसलाइपिडीमिया, हार्ट डिजीज, पॉलीसिस्टिक ओवेरियन डिजीज, डिमेंशिया, and emperor of all the maladies, that is cancer. My simple question to all the doctors, are those diseases are disease or just a manifestation of something else? We consider them disease because big pharma, big hospitals, big doctors, and government will not tell you. They will tell just these diseases are disease. They will not tell you these diseases are not disease. Why? It's a doctors and government tool to fool the people. If they teach you what is the actual disease, obviously everything will fall under healthcare, that is wellness program. And today you will be surprised how many of doctors are healthy. They are taking hypertensive, anti-hypertensive pills, anti-diabetic pills, thyroid medicines, becoming obese, maybe polycystic ovarian disease, dementia, Alzheimer's. There are so many things. And ultimately, this system is being labeled as sick care because sick doctors, sick patients, sick public, and sick government are leading this system. It cannot be healthcare system. Which is common is not normal. You can see in the park, everybody today in the era of e-rickshaw, even e-rickshaw puller, they are obese. Just imagine, this is metabolic syndrome. The root cause for everything, dyslipidemia, hypertension, diabetes, cancer, and all the kind of problem we see. The actual disease are these 8 diseases, but nobody will tell you because CDC, they don't have coding for these diseases. What are those? Glycation, oxidative stress, mitochondrial dysfunction, insulin resistance, membrane instability, inflammation, epigenetics, and autophagy. If you go to any of the non-communicable disease, root of these 8 are combinations, in combination 2, 3, 3, 4 kind of abnormality must be at the level of molecular health. And why doctors and government are not telling these are diseases? Because these diseases are not druggable. These diseases are foodable. We can prevent it, we can stop it, we can correct it with changes in lifestyle and especially food. But why this has become corporatization is the only reason. When you can pay less for the wellness, we are paying more for the sickness. And today, renaming is the need of the era. We call hospital as healthcare. We should rename it as sick care. We call Ministry of Health and Family Welfare. This should be renamed as Ministry of Sick and Unfair. We borrow by giving premium to health insurance, which doesn't cover health, cover disease. That should be labeled as disease insurance now. This change is needed. And need of the era is functional medicine, treating the system, not the symptoms. And that too, personalized medicine is the real answer. Why I'm talking about, if you consider cancer, as Dr. Gurdeep rightly said, only 5 to 10% cancers are genetic cancers. Just see the pie chart, 90 to 95% regions of behind cancer is in your environment. And out of that, 30-35% is diet. And nobody in a modern hospital or modern doctors is talking about the diet because in the entire curriculum of MBBS, 5 years, only 19.6 hours have been taught about nutrition and rest, nobody knows. Very unlikely, doctor like Shikha Sharma, who is having background of MBBS and dealing with nutrition, because nutritionists, they don't understand medical science, and we people from modern medicine, we don't understand nutritional science. Now cancer has been labeled as modern epidemic. Cancer can happen to anyone, be it celebrity, any caste, creed, religion, cult, culture, socioeconomic status. Therefore, prevention is always better than cure. How can we prevent it? हमारे शास्त्रों में लिखा है, क्षिति जल पावक गगन समीरा पंच रचित अति अधम शरीरा. 5 elements of life. Go to any of the system. These 5 elements directly or indirectly responsible for our health, as well as abnormality in these 5 elements can lead to disease. And the best example of Hindu Chhat Puja is the worship of all those 5 elements only. Full stop. No messenger, no pandit, no murti puja, no mandir, nothing. Just worshipping the 5 elements of life. And my strategy is to keep the people healthy away from cancer is MMMS. Meal, movement, mind stuff, and sleep. Only 4 pillars of health I consider. If you take these 4 pillars of health, you will not suffer from any of the non-communicable diseases, or chances, even if you are genetically prone, will be very less. First M is meal. And when we talk about the meal, consider food science and nutrition science. Remember, food science and nutrition science are entirely different. If we call food science, means whatever has been grown in the farm, from that area coming that stuff up to the lip is food science. What has been done to that element, how grown, how processed, everything. Nutritional science, the moment we put anything to eat from the lip area to the molecular level, that is nutrition science. As a doctor, we should understand both the things. And my understanding is today, what we call food is not food. If you consider the definition of Oxford University, what is food? Any substrate which helps either in burning or growth. Burning is mitochondrial, that is ATP production, and growth, any kind of cellular growth, that is food. But you'll come to know, whatever we are talking, those are not food. And हमारे शास्त्रों में डाइट के लिए कहा गया है, अन्नपूर्णे स्तापूर्णे शंकर प्राण बलवे ज्ञान वैराग्यम सिद्धार्थम भिक्षाम देहि च पार्वती. पहले भिक्षा में खाना दिया जाता था, भोजन जो खाने योग्य हो. आज अगर रेड लाइट पे आपकी गाड़ी खड़ी है, आप भोजन देंगे, पैसे नहीं देंगे तो कोई आपसे लेने को भी तैयार नहीं है. Why this has become? Because of fast food culture. And personally, I call it nutritional poverty. Because when you eat or drink this kind of food, nutritionally, you are gaining nothing. At the same time, it is actually hampering burning, means reducing ATP production, as well as hampering growth of the children, especially prepubertal. Why we are calling this processed and ultra-processed food? They don't have no fiber or low fiber. That's the only thing we can increase the shelf life of that food. High sugar content, especially fructose, added fructose, which disturb gut microbiome, means loss of fiber and high sugar content disturbing gut microbiome. Gut microbiome considered as a kind of second brain, then ultimately leading to alteration in mood by disturbing gut-mind axis. Today you can see why children are so irritable. Attention deficit disorder is becoming common. It inhibits mitochondrial function, what we are talking about, ATP production. Multiple insulin spike, directly and indirectly responsible for fatty liver, diabetes, polycystic ovarian disease, Alzheimer's disease, and cancer, and obesity. Processed and ultra-processed food, giving this only to the community. We call it junk food, fast food. Junk means kachara. Junk mail, not useful for us. Then why we are putting this kind of junk food inside our stomach, which is leading to metabolic syndrome? Modern medicine says acidic and fatty food can lead to acidity, heartburn, heart disease, and cancer. श्रीमद् भगवत गीता 17वें अध्याय में लिखा है, कटो अम्ल लवण अत्युक्ष्ण तीक्ष्ण रुक्ष्ण विदाहिनी आहार राजस इष्टा दुख शोकमया प्रदा. बहुत कड़वा, बहुत अम्ल मतलब एसिडिक, लवण मीन्स सॉल्टी, बहुत ज्यादा गर्म या बहुत ज्यादा तीखा खाने से दुख और शोक की प्राप्ति होती है. चाणक्य ने कहा था, भोजन भोजन शक्ति चरति शक्ति विरांगना विभवो दान शक्ति स न अल्पस्य तपसा फलम. किसी व्यक्ति को सुपाच्य भोजन मिल जाए, उसको पचाने की शक्ति हो, अपनी स्त्री को सुख रख सके और दान देने की शक्ति हो, किसी छोटी तपस्या का यह फल नहीं है. बाइबल में डिस्क्राइब किया गया था, गॉड क्रिएटेड मैन इन हिज ओन इमेज, इन द इमेज ऑफ गॉड क्रिएटेड हिम, मेल एंड फीमेल ही क्रिएटेड देम. गॉड ने जब क्रिएट किया तो एडम को कहा कि एडन गार्डन का फ्रूट्स मत खाना. गॉड ने कहा एडम को कि अपने कोई संगनी साथी दोस्त बनाओ. एडम वॉज अनेबल टू क्रिएट. देन गॉड क्रिएटेड वुमेन एज पर बाइबल. दिस इज जेनेसिस चैप्टर 1 वर्स 27. ये मेरा नहीं कहा हुआ है. Then God created Eve out of rib and flesh of Adam. That's the reason they call it woman, derived from man. Then Eve, एडम को समझा के एडन गार्डन का एप्पल खिलाया, बिकॉज एडम को पता था कि ये नहीं खाना है. दैट गॉट स्टक इन द थ्रोट, इसलिए मेल का यहां कहा जाता है एडम्स एप्पल. ये जेनेसिस में डिस्क्रिप्शन है, मे नॉट बी साइंटिफिक. Why we are running behind the fast food of the Western world? If you see the map of India from north to south, east to west, हर स्टेट की अपनी एक खास व्यंजन की विविधताएं हैं. If you stick to that classical Indian food, you'll get every nutrients, anti-cancer property, and you will not be any kind of disease if you don't go for fast food. Our Indian food have a high fiber food, rich in lycopene, anthocyanin, and multiple pigments and antioxidant, which is actually cancer prevention. But when we are talking about the fresh fruits and vegetable, Dr. Shikha will agree, we did kind of program at the Yamuna Khadar Sabjiyan, जो जहरीली थी, उसमें आर्सेनिक, कैडमियम, लेड, मरकरी, विच इज कैंसर फॉर्मिंग हेवी मेटल्स था. तो इन पॉइजनस वेजिटेबल की बात नहीं कर रहा हूँ. वेजिटेबल मीन्स प्योरली ऑर्गेनिक वेजिटेबल्स. अब खाने के बाद है कि कब खाना खाना चाहिए, क्या खाना चाहिए, कब खाना चाहिए. भूख और वासना, वी हैव टू अंडरस्टैंड डिफरेंस बिटवीन हंगर एंड लस्ट. इसके लिए सिंपली याद है कि भूख जब लगी हो तो कैसे आप समझेंगे कि अब मुझे खाना खाना है. भूख न देखे जूठी भात, नींद न देखे टूटी खाट, इश्क न देखे जात को जात. अगर इस तरह की भूख लगी है तभी खाना खाएं, अन्यथा ये वासना है. आप गुजर रहे थे, समोसे की खुशबू आई, पिज्जा की खुशबू आई, आपने उठा खा लिया. ओवर ईटिंग, दैट विल लीड टू ओबेसिटी एंड कैंसर. ईटिंग विंडो, कब खाना है. बिफोर सनसेट यू फिनिश लास्ट मील बिफोर सनसेट. At least 4 hours before bed must be there. And first meal should be 4 hours after wake up. Remember, liver is mother of all the organs. We have to give liver enough time to rest. जब आप खाना खा लेंगे, उसको डाइजेस्ट करके, लिवर जैसे माँ होती है घर की, बत्ती बंद करेगी, घर में ताला दरवाजे खिड़कियां सारा देख के चेक करके सोने जाएगी. जब लिवर सोने जाता है, उसको मिनिमम 5 घंटे का रेस्ट विदाउट फूड आपका स्टमक इंटेस्टिन चाहिए. अगर ये देंगे तो बहुत सारी बीमारियों से आप बचेंगे. वाई एम टॉकिंग अबाउट शुद्ध भारतीय भोजन. ज्यादा फाइबर होता है, एंटी कैंसर है. हरी सब्जी एवं फल, एंटी कैंसर. हल्दी, इसका मेरा इंटरनेशनल पेपर पब्लिश हुआ है. P53 हाइपरमिथाइलेशन, जो सेल के अंदर एब्नॉर्मलिटी उसको चेंज करता है, एंटी कैंसर. अजवाइन, लौंग, अदरक, लहसुन औषधि का काम करता है, एंटी कैंसर है. माई फॉर्मूला इज, रादर देन गोइंग फॉर KFC, go for KFS, that is keep food simple. How? रीजनल खाएं, सीजनल खाएं. पहला सूत्र, आपके क्षेत्र में जो भी साग सब्जी फल फूल होते हैं वही खाएं, और जिस ऋतु में, जिस सीजन में ये सब्जियां फल हो रहे हैं वही खाएं. प्रिजर्व ना खाएं. नेचुरली कलर्ड खाएं. प्राकृतिक रूप से जो रंगीन सब्जियां, रंगीन फल हैं वही खाएं. कॉम्बो ऑफ प्रोटीन, फैट, कार्ब, मिनरल, एंटीऑक्सीडेंट, विटामिन सारा चाहिए आपको. होममेड एंड फ्रेश फूड खाएं. एंड बैक टू बेसिक्स, B2B, दैट इज होलसम ग्रेन फॉर होलसम हेल्थ. अगर ये करते हैं तो फाइबर और कार्ब का रेशियो किसी भी आपके ग्रेन्स में एप्रोप्रिएट मिलेगा, न कि KFC में मिलेगा. इसलिए जनरेट योर ओन ब्रांड, दैट इज KFS, कीप फूड सिंपल. गैस्ट्रोनोमिक जर्नी, मैक्सिमम लोग जब मैं प्रेजेंटेशन करता हूं तो पूछते हैं कि बच्चे नहीं मानते हैं. पहला सूत्र, इन्वॉल्व चिल्ड्रन इन रेसिपी डिजाइन. उनसे पूछिए, उनको इन्वॉल्व कीजिए, किस तरह से हम क्लासिकल रॉ रीजनल फूड को हम घर में तैयार करें. लर्न टू से नो. जैसे कहीं जाते हैं, मिठाई आती है, स्वीट्स, फूड, स्पेशली व्हेन यू आर फुल, लर्न टू से नो. मना करें, मैं नहीं खाऊंगा, ओवर ईटिंग है. मेक अ फूड डायरी. स्टार्टिंग में महीने 2 महीने आपको दिक्कत होगी. एक फूड डायरी बनाएं कि आपने क्या खाया, कब खाया, कितना खाया. व्हेन यू कम बैक आफ्टर 1 month, यू विल बी सरप्राइज कि आपके चेंजेस कैसे ट्रांजिशन हो. दैट इज, आई कॉल इट गैस्ट्रोनॉमिक जर्नी. सप्लीमेंट फूड, नॉट फूड सप्लीमेंट. आजकल फूड सप्लीमेंट का बड़ा सिस्टम चल गया है कि omega-3 दिस दैट. सप्लीमेंट फूड लें, ना कि फूड सप्लीमेंट की जरूरत है. रीड द लेवल, मेक हैबिट. कोई भी चीज खरीद के लाते हैं, उस पर जो लेवल लगा हो उसको पढ़ें. हैप्पी ईटिंग वर्सेस हेडोनिस्टिक ईटिंग. हेडोनिस्टिक ईटिंग, सुखवाद के लिए खाना खाना, विच रिलीज डोपामिन. हैप्पी ईटिंग मतलब भूख लगी तब खाना खाना. मिंडोइन मेथड वर्सेस सेक्सी सॉल्यूशन. अगर ये सब आप अपने जीवन में उतारते हैं, गैस्ट्रोनॉमिक जर्नी विल बी स्मूथ। ब्राजील ने क्लासिफिकेशन दिया प्रोसेसिंग ऑफ द फूड, टाइप 1, टाइप 2, टाइप 3, टाइप 4। टाइप 3 एंड टाइप 4 को प्रोसेस्ड एंड अल्ट्रा प्रोसेस्ड फूड बताया गया है, विच हैज बीन प्रोसेस्ड मींस सेल्फ लाइफ हैज बीन इंक्रीज्ड, बट सेल्फ लाइफ, इंसान की खुद की लाइफ कम कर दी। इसको सिंपल, अब लोग समझ रहे हैं क्या खाना नहीं खाना है। भारतीय फॉर्मूला देता हूं। 3 प्रकार के रसोई हैं। पहला, भगवान की रसोई, मतलब प्राकृतिक चीजें एज इट इज आप खा सकती हैं। ये नॉर्मल भगवान की रसोई आपको स्वस्थ रखेगा, बीमार नहीं करेगा। दूसरा, इंसान की रसोई, शुद्ध भारतीय भोजन जो भारतीय रसोई में बन रही हो, ये ताजा खाएं। इंसान की रसोई ये भी आपको स्वस्थ रखेगी। और तीसरा, शैतान की रसोई, जितने लाल पीले नीले डब्बे और बोर्ड लगा के या पैक्ड फूड, डॉक्टर गुरदीप भी डिस्कस कर रहे थे, ऐप बेस्ड फूड रात में मंगा खाते हैं, ये शैतान की रसोई है। कोई इंसान आपके लिए, आपके भले के लिए खाना नहीं बना रहा है। नंबर 1, क्वालिटी खराब, प्लास्टिक का पैकेट, गर्म खाना उसमें पैक हुआ, बिस्फेनॉल या थैलेट्स लीच किया, आपने सर्कैडियन रिदम ब्रेक किया, रात को खाना खाया, फ्रिज में रखा, बचे खाने को फिर गर्म करके खाया। एवरीथिंग इज नथिंग, मकर जाल है कैंसर का, इसमें और कुछ नहीं है। My formula is feed the gut, protect the liver, and support the brain. If you really want to be disease-free life, feed the gut, protect the liver, and support the brain. कैसे? Feed the gut means give fiber to your gut microbiome. प्रोटेक्ट द लीवर, लीवर पे सडन ग्लूकोज फ्रुक्टोज का लोड ना दें, फैटी लीवर होगा। एंड सपोर्ट द ब्रेन, अगर गट माइक्रोबायोम ठीक हो रहेगा, गट के अंदर सेरोटोनिन बनेगा आपके माइक्रोबायोम से, और उसके बाद ब्रेन को मिलेगा, ब्रेन का हैप्पी रहेगा, आपको कहेगा थैंक यू। कैसे कर सकते हैं इसको? रॉ खाएं, रियल खाएं, रीजनल खाएं, सीजनल खाएं, ईटिंग विंडो लेस देन 8 आवर्स कर दें, लो और नो प्रोसेस्ड कार्ब खाएं, रीडिफाइन योर फूड rather than refined food. फर्स्ट फाइबर लें, देन प्रोटीन फैट लें, देन अगर खाना है तो कॉम्प्लेक्स कार्ब छोटा सा अमाउंट 1 ग्राम पर किलोग्राम बॉडी वेट लें, जैसे प्योर ब्राउन राइस या कंप्लीट ग्रेन्स मिलेट्स, इसको लें 1 ग्राम पर किलोग्राम बॉडी वेट। देन ओमेगा 3 सप्लीमेंट, बेस्ट सोर्स इज एलजी एंड वाइल्ड फिश, उससे मिल सकता है। एंड नो हेडोनिक ईटिंग, अगर ये करते हैं यू विल गेट फीड द गट, प्रोटेक्ट द लिवर एंड सपोर्ट द ब्रेन। प्लांट बेस्ड फूड ऑलवेज फाइबर आपको देगा, प्रोटीन फैट आपके खाने में चाहिए। फर्मेंटेड वेजिटेबल्स, जो साउथ कोरिया का बड़ा पॉपुलर है किमची, जबकि इंडिया में बहुत सारे हर स्टेट में कुछ ना कुछ फर्मेंटेड वेजिटेबल का एक कल्चर था जो लोग शहरों में आज भूल चुके हैं। एंड होलसम फूड फॉर होलसम हेल्थ। लोग सोचते हैं इज इट पॉसिबल इन सिटी लाइक एनसीआर और दिल्ली? यस, डायरेक्ट फार्मर परचेज, आप किसानों से 100 किलोमीटर के अंदर बात कर लें, वो आपके लिए फर्टिलाइजर इंसेक्टिसाइड के बिना उगाएंगे। 10 फैमिली जमा हो, महीने में एक बार जाएं, पिकनिक भी करें, 10 फैमिली के लिए आपका सामान आ जाएगा, घर में आटा गेहूं चावल सब रखें, तैयार हो जाएगा। ईदर पे द फार्मर और पे द डॉक्टर्स। आई एम बोथ, फार्मर एज वेल एज डॉक्टर, चॉइस इज योर्स। क्षिति के बाद जल पे आते हैं। जल ग्रहण निःशुल्क, पहले माना जाता था वाटर फ्री है, शुद्ध है, डिटॉक्सिफाई करता है, इसलिए फॉर्मूला था कि बॉडी वेट का 1/20वां हिस्सा आप पानी लें। लेकिन आज क्या हो गया, मैं ऐसे विज्ञान का विद्यार्थी हूँ, बड़ी छोटी जगह पैदा हुआ, गंगा के तट पे घर था, बागीचा था, गाय रहती थी। तभी एक बार दिल्ली में आ रहा था, फ्लाइट से देख रहा था कि मेरा घर कहाँ होगा, तो सिर्फ मुझे कंक्रीट जंगल बिल्डिंगें दिखी, लाइट दिखी, ना कोई जंगल ना कुछ। उसी पे मैंने एक रचना लिखी थी, 4 पंक्तियां बीच की हैं। पत्थरों के इस शहर में एक पत्थर था मेरा, दिल्ली, ना थी गैया ना था बछड़ा ना था बागीचा मेरा, क्षीर बंद था दूध पैकेट में है, नीर बंद था पानी बॉटल में है, क्षीर बंद था नीर बंद था और बंद किस्मत मेरा, ना थी हरियाली यहाँ ना था वो दरिया मेरा, ना था वो दरिया। पानी पीने का समुचित समय क्या है? सुबह जगने के बाद पिएं 2 गिलास, स्नान से पहले इनर कोर टेम्परेचर डाउन होगा, दोपहर के खाने से पहले पी लें, खाने के 2 घंटे बाद न पी लें, टू कीप द डाइजेस्टिव जूसेज वर्किंग। सूर्यास्त के समय पिएं और सोने से पहले पिएं। अगर इतना पिएंगे 3 से 4 लीटर पर डे पानी का आपका कंजम्पशन हो जाएगा। कुरान में एक आयत है जिसको इंग्लिश में मैंने ट्रांसलेट कर दिया, फिल हाफ स्टमक विद फूड, 1 क्वार्टर विद वाटर एंड लीव 1 क्वार्टर फॉर द मूवमेंट ऑफ एयर। लेकिन आज इंसान खाना खाता है गले तक, कहाँ पानी कहाँ एयर मूवमेंट की जगह बचेगी। गुटखा contains all things related to cancer. Gutka is more common than cigarette in India, leading to reduced mouth opening, cancer. Cigarette simply says we kill. जितने लोगों से मैंने पूछा, अपने अनुभव पे मैंने स्लाइड डाली, किसी ने बोला कि मैं किक के लिए लेता हूं, बट दे आर नॉट अवेयर दैट किकिंग देयर ओन लाइव्स. किसी ने कहा एक्टिव रहने के लिए लेता हूं. 2 minutes ऑफ योगिक स्ट्रेचिंग इन द ऑफिस कैन कीप यू मोर एक्टिव देन सिगरेट. एंड कुछ लोगों ने कहा स्टाइल के लिए, जो इनको समझ के सेलिब्रिटी समझते हैं, दे आर नॉट योर सेलिब्रिटी, ये आप बीमार कर रहे हैं आपको. सिगरेट में 365 दिन का सेल चलता है. बाई सिगरेट just for kick, but you are getting 4,000 chemical. Out of that 4,070 chemicals are cancer forming. Additionally आपको हार्ट डिजीज, इम्पोर्टेंस और बहुत सारी प्रॉब्लम तो होगी. है अल्कोहल, रंगीन पानी, जिसको सिंपली कहते हैं शराब, आला, मदिरा. जितनों से मैंने पूछा 3 चीजों के लिए लिया. आई एम द किंग, ऑल इज वेल, नो टेंशन, बिंदास है भाई. लोग कहते हैं अमिताभ बच्चन के पिताजी श्री हरिवंश राय बच्चन ने मधुशाला जो रचना लिखी, आप तो मना कर रहे हैं. तो उन्होंने क्या लिखा था मधुशाला में? मधुर भावनाओं की सुमधुर नित्य बनाता हूं हाला, भरता हूं इस मधु से अपने अंतर का प्यासा प्याला. उन्होंने कभी नहीं शराब की बात कही थी. गांधी जी ने कहा था अल्कोहल इज नॉट द आंसर टू लाइफ क्वेश्चन. तो विजय माल्या ने जब किंगफिशर लॉन्च किया तो उन्होंने लिखा था गांधी जी को कोट करते हुए, एटलीस्ट इट हेल्प्स यू टू फॉरगेट द क्वेश्चन. तो मैंने दोनों को कोट करके लिखा, एटलीस्ट यू कैन इन्वेस्ट दैट टाइम इन सर्च फॉर द आंसर, चॉइस इज योर्स. गांधी जी डिमोनेटाइजेशन के बाद भी हमारे नोट पे हैं, विजय माल्या आपके नोट लेके भागे हुए हैं. चॉइस किसको आप फॉलो करेंगे? मानव का विकास, ऐसा डार्विन थ्योरी मानता है कि चौपाया से दोपाया हुआ, लेकिन आज फिर मनुष्य दोपाया से उसको वैशाखी के तौर पे तंबाकू, गुटखा, शराब, सिगरेट की जरूरत होने लगी. एवरी टाइम यू ईट और ड्रिंक यू आर ईदर फीडिंग डिजीज और फाइटिंग अगेंस्ट इट. देयरफॉर जब भी कोई निवाला के लिए उठाएं तो ये याद रखें. सारांश में क्षितिजल का खाना पीना क्या खाना है? शुद्ध भारतीय भोजन, हरी सब्जियां, फल, खा ना फास्ट फूड, पैक्ड चिप्स और ये सारी चीजें, पी ना शराब, सिगरेट, बीड़ी. फर्स्ट एम. देन सेकेंड एम इज मूवमेंट. मतलब एक्सरसाइज क्या होनी चाहिए? इसका फॉर्मूला मैं देता हूं फार्ब, FARB, फ्लेक्सिबिलिटी, एरोबिक्स, रेजिस्टेंस ट्रेनिंग एंड बैलेंसिंग. अगर इसको करेंगे, देयर आर लॉट ऑफ रिकमेंडेशन कि कितने देर करना चाहिए एक्सरसाइज, कैसे करना चाहिए, क्या करना चाहिए. लेकिन कोई आपका जिम में बाइसेप्स बनवा रहा है, कोई ट्राइसेप्स, कोई पेक मेजर बनवा रहा है. अगर इन सबको फार्ब टेक्नोलॉजी को करें तो आंसर इज योगासना. योगासना कैन गिव यू एवरीथिंग, फ्लेक्सिबिलिटी, एरोबिक्स, रेजिस्टेंस ट्रेनिंग एंड बैलेंसिंग. इसलिए कंप्लीट हेल्थ के लिए योगासन इज द बेस्ट आंसर. एंड डेविड कॉल्टर, अमेरिकन एनाटमिस्ट है, इंडिया आया, अष्टांग योग सीखा, उसने किताब लिखी एनाटमी ऑफ हठ योगा. और हमारे इंडियंस को ये पता नहीं है इसने किस लेवल की किताब लिख दी. प्रोप्राइसेप्शन से लेकर सारा कुछ एक एक योगिक पोस्चर का डिस्क्राइब किया इसमें. जो लोग कहते हैं रेगुलर एक्सरसाइज नहीं हो पाती है, छूट जाता है, रिमेंबर गुड हैबिट्स आर एज एडिक्टिव एज बैड हैबिट्स एंड लॉट मोर रिवॉर्डिंग. चॉइस इज योर्स. मोटापा, इंसान यंग एज में रहता है, बिल्कुल सीधा होता है, बाद में उसका मध्य प्रदेश मतलब पेट का हिस्सा बड़ा होता जाता है, उत्तर प्रदेश मतलब दिमाग खाली होता है, और दक्षिण प्रदेश मतलब घुटना टूटने लगता है. फिर उसको हम सर्जन बदल देते हैं. मोटापा का डेफिनेशन बहुत सारा है कि वेस्ट सरकमफ्रेंस कितना होना चाहिए. नेवर, दिल्ली में ऑन रिकॉर्ड 30% से ज्यादा लोग मोटे हो चुके हैं. और ओबेसिटी इस कदर बढ़ रही कि हमारे वैज्ञानिक शोध कर रहे हैं कि इस तरह की ट्रॉली बनाया जाए जो इंसान के टमी को लेके चल सके. ऐसा हुआ क्यों? लाइफ कंपास अगर देखेंगे तो दिल्ली वालों की लाइफ 3M में उलझ के रह गई है. घर, ऑफिस, ऑफिस, घर, और इसके बीच में 3M है, मॉल, मूवी, मदिरा. तो ऐसे व्यक्ति को स्वस्थ कैसे रखा जाता है जब दिनचर्या ही खराब हो गई? जब मेरे दादाजी का समय था, लेफ्ट स्लाइड में आप देखें, सूरज की पहली किरण निकल रही होती, दादाजी मॉर्निंग वॉक करके अपने दिनचर्या को खत्म करके लौट रहे होते थे. आज सुबह 10 बजे की कहानी है, बाप भी सो रहा है, बेटा भी सो रहा है. ये बो एंड एरो ह्यूमनॉइड एक मैंने कॉन्सेप्ट दिया कि आज का इंसान कैसा हो गया है. जैसे उसकी टमी निकल गई, स्पाज्म में इलियोसवास मसल का हो गया, ओबेसिटी, स्कोलियोस, काइफोसिस, सॉरी लॉर्डोसिस, और स्टिफ बैक. ये पूरा आप देखेंगे तो एक जैसे धनुष में तीर लगाया हुआ है. तो अगर ऐसा व्यक्ति बो एंड एरो ह्यूमनॉइड दिखे तो बेसिकली उसकी तीर छूटने वाली है, मतलब जीवन से वो निकलने वाला है, इसको करेक्ट करके हमें स्ट्रेट ह्यूमन होमोसेपियंस इरेक्टस बनाना है। फैट इज नॉट फैट, 3 डिपो ऑफ फैट। ओबेसिटी बहुत बड़ा कारण है कैंसर का और हार्ट डिजीज का। 3 डिपो है, 3 गोदाम है फैट का, सबक्यूटेनियस फैट, विसरल फैट एंड फैटी लिवर, दैट इज फैट इन द लिवर। सबक्यूटेनियस फैट मोर देन 10 kg चाहिए टू मेक यू सिक, मतलब सबक्यूटेनियस फैट एपरेंटली उतना नुकसानदायक इन्फ्लेमेटरी साइटोकाइंस पॉइंट से नहीं है जितना लोग सोचते हैं। विसरल फैट इज मोर डेंजरस, मोर देन 2.5 kg कैन मेक यू डिजीज इन क्रोनिक इन्फ्लेमेशन, हार्ट डिजीज एंड कैंसर। एंड विसरल फैट के पीछे जो वजह है, फॉर्मूला इज सासू, स्ट्रेस, अपनी सासू माँ वाला नहीं, स्ट्रेस दैट इज क्रोनिक कॉर्टिसोल लीडिंग टू विसरल फैट, अल्कोहल, स्लीप डिप्रिवेशन एंड अल्ट्रा प्रोसेस्ड फूड। ऐसे लोगों को पफी फेस, लव हैंडल, पॉट वेली, नेक में ब्लैक लाइनिंग एंड वेस्ट सर्कमफ्रेंस ज्यादा होगा। विसरल फैट मोर प्रोन टू कैंसर। मायोस्टिटोसिस, मसल के बीच में फैट जमा हो जाना, इट बिहेव्स लाइक विसरल फैट, अगेन लीडिंग टू कैंसर। फैट इज नॉट फैट, व्हाई आई एम सेइंग वन कॉन्सेप्ट इज टॉफी, थिन ऑन द आउटसाइड एंड फैट द इनसाइड। एशियन में ज्यादा कॉमन है, इंडियन चाइनीज में, मतलब सिर्फ पेट निकला होगा, ऊपर से दुबला पतला होगा। 40 यूरोपियन में ज्यादा कॉमन है, फैट फ्रॉम आउटसाइड एंड थिन इनसाइड, विसरल फैट कम हुआ, तो ऐसे व्यक्ति को रिस्क कम है एज कंपेयर टू टॉफी। ओबेसिटी का रीजन HFCSS, हाई इन शुगर, हाई इन सॉल्ट, हाई इन कैलोरी, कैलोरी डेंस फूड, ये आपके ओबेसिटी का कारण बना हुआ है। कैलोरी इज नॉट कैलोरी, जो बोन कैलोरीमीटर में डालते हैं, ऑल कैलोरी आर नॉट कैलोरी। स्पेशली दिल्ली वाले कहते हैं मैं तो खाना कम खाता हूं फिर भी मोटा हो रहा हूं। ओबेसोजेंस, ये आपके इर्द गिर्द वातावरण का प्रदूषण से लेके नॉन स्टिक तवे में जो केमिकल है, जिसको फॉरएवर केमिकल कहते हैं, प्यूफा एंड पोफा, ये आपको ओबेसोजेंस है, इसके कारण मोटापा बढ़ रहा है। सर्टेन हिडन एंड फैक्ट लाइक प्लास्टिक हमारे वातावरण में चारों तरफ हो गया है, जिसको एंटीक करके आपने रख दिया है अलमीरा में, इसको निकालिए आज, पीतल के बर्तन को, तांबे के बर्तन को, क्योंकि माइक्रोप्लास्टिक्स है एंटर एवरीवेयर लीडिंग टू इम्पोर्टेंस, हार्ट डिजीज एंड कैंसर। बिस्फेनॉल A and phthalates are mainly responsible for low sperm count, thyroid problem and cancer in females. Microwave स्टडी चल रही है, नॉट वेरी क्लियर बट ट्रेंड टुवर्ड्स इंक्रीजिंग रिस्क ऑफ कैंसर। इंसेक्टिसाइड एंड फर्टिलाइजर्स मोर रिस्पॉन्सिबल फॉर कैंसर। फ्रूट राइपनर लाइक कार्बाइड एंड इथेफेनॉल, हम लोग टीवी पे काफी प्रोग्राम इस पे कर चुके हैं। ऑक्सीटोसिन, जो सब्जियां बड़ी कर दी जाती है ओवरनाइट। थर्ड इमेज माइंड स्टफ। माइंड स्टफ का हिंदी है चित्त। महर्षि पतंजलि से पूछा कि गुरुजी योग है क्या, तो उन्होंने एक सूत्र दूसरे सूत्र में ही कह दिया, योग चित्त वृत्ति निरोध, चित्त की वृत्तियों का सदैव के लिए रुक जाना ही योग है। माइंड एबनॉर्मल माइंड स्टफ आर डायरेक्टली एज वेल एज इनडायरेक्टली रिस्पॉन्सिबल फॉर कैंसर। एंड द फर्स्ट प्रॉब्लम फॉर डिस्टर्बिंग माइंड स्टफ ही मोबाइल। पहले क्या था, इंसान चलित था, फोन स्थगित था। आज इंसान स्थगित हो गया, फोन चलित हो गया। ऑफिस में फोन, शौचालय में फोन, शयन कक्ष में फोन, गर्भवती महिलाओं के पेट पर फोन, वाहन चलाते समय फोन, मंदिर में फोन। क्या हुआ, नजदीकियां बढ़ी है दूरियां। राइट साइड में देखिए स्लाइड है, जिसमें फोन नहीं था, सब लोग बैठ के अपने में बात करते थे। आज सब साथ बैठे हैं, व्हाट्सएप फेसबुक की दुनिया पे लगे हुए हैं, काल्पनिक दुनिया में हो रहे हैं रिश्ते खराब। रात में देख लिया ऑनलाइन है, आपने जवाब नहीं दिया, हो गए रिश्ते खराब। सर्जन्स अनहैप्पीनेस, मैंने कहा नोमो, ऑपरेशन करके सर्जन निकलता है, सर्जन रूम में बैठ के वो पूरे टाइम या तो स्टॉक एक्सचेंज पे, नेटफ्लिक्स पे या ऑनलाइन शॉपिंग में लगा रहता है। मैं कहता हूँ नोमो, नमो न पॉलिटिकल ना समझें, नो मोबाइल फोन फॉर एटलीस्ट 15 मिनट्स। जब ऐसे काम से निकल रहे हैं जहां एनर्जी रस आपका काफी है, थोड़ी देर के लिए आप नो मोबाइल जोन में जाएं। डोपामिन बड़ी अच्छी किताब है, जो पढ़ना चाहें पढ़ें। मोबाइल फोन के इस्तेमाल से, स्क्रीन के इस्तेमाल से डोपामिन रिलीज होता है ब्रेन में, जो जिसको कहते हैं मॉलिक्यूल ऑफ मोड। ये और आपको एडिक्ट बनाता रहेगा। इट इमिट्स रेडियो फ्रिक्वेंसी वेव्स विच लीड्स टू चिड़चिड़ापन, बेचैनी, अनिद्रा एंड इंक्रीजिंग ट्रेंड टुवर्ड्स ग्लायोब्लास्टोमा मल्टीफॉर्मी, दैट इज ब्रेन ट्यूमर। कई इस पे भी कार्यक्रम इस पे हुए। स्ट्रेस, क्रोध, एंजाइटी, jealous, revenge, these are common, but human cannot be alive without stress. How stress is related to obesity? Because of cortisol. First and foremost reason for stress, पूछ, कहीं जाते हैं किस तरह से पूछा गया, कितनी इज्जत मिली। एंड सेकेंड इज पूछ, भैंस निकल गई, उसकी पूंछ अटक गई, मतलब अहंकार उसका वहीं अटक गया। इंसान आज स्ट्रेस में इस कारण है। कितने व्यक्ति हैं जो आज स्वच्छंद, उन्मुक्त और तनाव रहित वैसे रहते हैं जैसे बचपन में थे। फियर फैक्टर, अनदर रीजन फॉर स्ट्रेस। या तो इंसान भय में है, या निर्भय दुस्साहसी हो चुका है। अभय की स्थिति कितने में है? हंसना मना है। ये मेरे दोस्त हैं, बड़े कारोबारी हैं, इन्होंने हंसना बंद कर दिया। मैंने पूछा क्यों, तो बोला कि हंस के बात करते हैं तो लोग काम नहीं करते हैं ऑफिस में। और डॉक्टर शिखा के मैं ऑफिस गया हूँ, पूरे टाइम हंसते रहती हैं, इनका काम तब भी चलता है, मुझे यही लगता है। हमारे शास्त्रों में कहा गया, अर्था भवन्ति गच्छन्ति लभ्यते च पुनः 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 कदापि न आयति गतम तु न यौवनम। अर्थ मतलब धन, आएगा चला जाएगा, दोबारा प्राप्त कर लेंगे। पुनः कदापि न आयति, दोबारा नहीं आएगा। गतम तु न यौवनम, जो अवस्था मिली है इसको जीना शुरू करें। ओशो ने कहा था, हंसना एक महाऔषधि है। हंसने के व्यक्तिगत फायदे, शारीरिक, हेड एंड नेक की जितनी मसल से मांसपेशियां, इसकी एक्सरसाइज होगी। इसका कोई डंबल, कोई ट्रेडमिल नहीं बना है। आपके चेहरे पे झुर्रियां देर से आएगी। मानसिक फायदे, न्यूरोसाइंस में रिसर्च पब्लिश हुआ कि हंसना, जो स्पॉन्टेनियस हंसते हैं, डोपामिन, एंडोर्फिन, ऑक्सीटोसिन और सेरोटोनिन रिलीज होता है। एंग्जाइटी और जेलस कम रहता है आपका। सामाजिक फायदे, हंस के मिलेंगे लोगों से, लोग आपके दोस्त बनते जाएंगे। और पारंपरिक फायदे, माना जाता है हंसने का जहाँ माहौल होता है वहाँ धन धान सुख सौभाग्य संपत्ति की प्राप्ति होती है। तो हंस के देखें, एक हफ्ते अगर बुरा लगेगा तो हंसना बंद कर दीजिएगा। लेकिन ऐसे हंसने का फायदा नहीं है। मेरे घर के पीछे एक क्लब है, पार्क है, उसमें लाफ्टर क्लब चलाते हैं। ये 6:50 से 7 बजे तक हंसते हैं, उसके बाद हंसना बंद करते हैं। मैंने पूछा ऐसा क्यों करते हैं, तो बताया कि ऑफिस में अगर हंसता हूं तो सबॉर्डिनेट काम नहीं करते, घर पे हंसता लौटता हूं तो बीवी पूछती है कोई गर्लफ्रेंड मिल गई क्या, बड़े खुश नजर आ रहे हो। तो इस हंसने का साइंस से कोई फायदा नहीं है। मिड लाइफ क्राइसिस वर्सेस 4 फेजेज। अब मिड लाइफ क्राइसिस ये कॉमन होता जा रहा है, स्पेशली मेट्रो सिटीज में, खास करके 40, 45, 50 जो अचीव कर लेते हैं उनमें। हमारे इसमें लिखा गया था शास्त्रों में, 4 अवस्था है जीने की, ब्रह्मचर्य, गृहस्थ, वानप्रस्थ। अगर इन अवस्थाओं को हम मेंटली एक्सेप्ट करें तो मिड लाइफ क्राइसिस की प्रॉब्लम सच में नहीं आएगी। लव योर सेल्फ, स्पेशली फीमेल से मैं कहूंगा, पहले अपने आप से मोहब्बत करें। यू विल इमिट पॉजिटिव ऑरा, पीपल विल स्टार्ट लविंग यू, डोंट एक्सपेक्ट लव फ्रॉम अदर्स। बी स्पॉन्टेनियस, ये बहुत पुरानी तस्वीर है। मैं बंगाल बुलाया था एक लेक्चर के लिए गायत्री परिवार ने, तो चारा काटने की मशीन दिखी, मैं काटने लगा। जो चीजें आपको करने की इच्छा हो कर डालिए, अगर उससे किसी को नुकसान नहीं हो रहा है। हॉबी, मस्ट डेवलप हॉबी, स्पेयर टाइम एक्टिविटी, go to the hospital, clean the society, do some kind of community gardening, go to the hospital, talk to the patients, socialize with your friends, जिनसे मन मिलता हो उनके साथ बैठें, अच्छी बातचीत करें। फॉरगिवनेस, कहा गया क्षमा सोबती उस भुजंग को जिसके पास गरल हो, उसको क्या जो दंतहीन विषहीन विनित सरल हो। फॉरगिवनेस की आदत डालें, दैट विल डिक्रीज योर स्ट्रेस। महर्षि वेद व्यास से पूछा गया, गुरुजी 18 पुराण लिख दिए कि इसका सारांश क्या है। उन्होंने कहा, अष्टादशे पुराणेषु व्यास न वचनद वयम परोपकार है पुण्याय पापाय परपीडनम। दूसरों को अगर परोपकार करते हो तो पुण्य है, दूसरों को पीड़ा देते हो पाप है। बस इतना ही सारांश में उन्होंने कह दिया। डिकोड योर एंगर, रिमेंबर एंगर इज नॉट अ प्राइमरी emotion, is always a pillar that rises from the floor of humiliation. Atma-sanyam, develop self-control. Introspection, before going to sleep, must do some kind of introspection. क्या क्या आज हुआ, क्या नहीं हुआ। पहले गिल्ट और डिस्पेयर, अब हो गया। पहले होप और हैप्पीनेस, डॉक्टर शिखा को याद होगा, डॉक्टर गुरदीप को याद होगा, हम लोग इस समय कैसेट आया करता था, रील उलझ जाती थी, पेंसिल लेके घंटों सुलझाते रहते थे विद ए होप कि किशोर के गाने फिर से बजेंगे, रफ़ी के गाने बजेंगे, तो हैप्पीनेस। आज गिल्ट और डिस्पेयर में इंसान जी रहा है, क्योंकि इस तरह की चीज़ों में जो बेसिक खुशी थी वो खत्म हो गई, सारी चीज़ें इजीली अवेलेबल हो गई। जोहारी विंडो एक है जिसमें राइट लोअर कॉर्नर अननोन सेल्फ, इसको एक्सप्लोर करें, विच इज नॉट योर पोटेंशियल पावर, नॉट नोन टू यू नॉट नोन टू द वर्ल्ड, इसको ओपन करें। वर्तमान में जीना सीखें। वर्तमान कहा जाता है भविष्य के गर्भ से निकलकर अतीत के गर्भ तक जाने की बिल्कुल सहज, तरल और सरल अवस्था को वर्तमान कहते हैं। वर्तमान में जीना सीखें। लोग टाइम मैनेजमेंट के लिए बहुत परेशान रहते हैं। मैं हर समय कहता हूं, समय बीतता है या हम बीत जाते हैं। जरा सोचिएगा, समय नहीं बीतता है, हम बीत जाते हैं। अगर हम वर्तमान में जीना चालू करें, विच इज मोस्ट फ्लूइड एंड डायनेमिक स्टेट, तो हम समय से सिंक हो जाएंगे। जापान का एक कॉन्सेप्ट है इकिगाई, वही काम करें, वेयर योर पैशन, मिशन, वोकेशन एंड प्रोफेशन मीट, यू विल रीच द स्टेट ऑफ इकिगाई। इचिगो इची, अनदर कॉन्सेप्ट फ्रॉम जापान, आर्ट ऑफ मेकिंग मोस्ट ऑफ एवरी मोमेंट। जिस मोमेंट में है उसको पूरी तरह जी लें, उसी मोमेंट में रह के आगे की ना सोचें, ना पीछे के लिए पश्चाताप करें। माइंडफुलनेस, सचेतन की अवस्था, जो भी करें फुल माइंडफुलनेस। इवन ब्रश कर रहे हों, चल रहे हों, जूते का फीता बांध रहे हो, माइंडफुलनेस, सचेतन की अवस्था में। सभी लोग कहते हैं कि बुरा वक्त आ गया। ह्यूमन लाइफ है इसीलिए रोलर कोस्टर होगा, ऊपर भी जाओगे नीचे भी आओगे। तो जब ऊपर जाते हो तब तो किसी को नहीं कहते बड़ा अच्छा वक्त आ गया। तो आदत डालो, ईसीजी में भी जब वेव ऊपर नीचे हो रहा था तभी इंसान जीवित होता है, फ्लैट हो जाता है तो इंसान मर जाता है। इसलिए रोलर कोस्टर है तभी ह्यूमन लाइफ है। बुद्ध ने कहा था संसार में दुख है, दुख का कारण है, दुख निवारण संभव है, दुख निवारण हेतु अष्टांगिक मार्ग का पालन करें। हैप्पीनेस, हेल्थ, हैप्पीनेस इज द वे टुवर्ड्स हेल्थ। अब हैप्पीनेस में लोगों को कंफ्यूजन है कि हैप्पीनेस और हेडोनिज्म में क्या अंतर है। हैप्पीनेस इज आनंद, हेडोनिज्म इज सुखवाद। हैप्पीनेस कभी भी इट विल इंश्योर, यू कांट परस्यू हैप्पीनेस। हैप्पीनेस इज जर्नी, इट्स नेवर ए डेस्टिनेशन। Believe it or not, money cannot lead to happiness. And last formula is sleep. When I talk about sleep, disturbed circadian rhythm means रात में जगना, दिन में सोना lead to obesity and cancer. This is the formula how sleep deprivation lead to DNA repair, multiple time DNA repair leading to cancer. योग निद्रा इज ए वेरी गुड सोल्यूशन। जिनको नींद की दिक्कत है, योग निद्रा अपने जीवन में उतार सकते हैं। व्हेन यू स्लीप, स्लीप लाइक दिस एंड वेक अप लाइक ए टेंडर लीफ, वेरी फ्रेश। कोई सर भारी ना हो, कमर में दर्द ना हो और आलस ना आए, मतलब नींद पूरी हो गई। मेरे पिताजी कहते थे जिस बुलंदी पे जाके इंसान छोटा लगे उस बुलंदी को पाना ना चाहिए, रीढ़ की हड्डियां भी चटकने लगे, सिर को इतना झुकाना ना चाहिए। क्या ये संभव है जो भी मैंने अभी तक बताया? 3 पॉसिबल स्टेट्स ऑफ बीइंग है, अटैचमेंट, डिटैचमेंट, अनअटैचमेंट, मतलब आसक्ति, विरक्ति, अनासक्ति। क्या ये संभव है कि नीदर विल रिमेन अटैच नॉट डिटैच, मीन्स अनासक्त की स्थिति में, अनअटैचमेंट की स्थिति में? समाधान यस, GOD। गॉड को मैंने देखा नहीं इसलिए उस वाले गॉड की बात मैं नहीं कर रहा हूं। G फॉर जनरेटर, O फॉर ऑर्गेनाइजर एंड D फॉर डिस्ट्रॉयर। बी जनरेटर मीन्स ब्रह्मा ऑफ योर सेल्फ इन द मॉर्निंग, पूरे दिनचर्या की प्लानिंग कर लें कि आज मुझे दिन में क्या करना है। बी ऑर्गेनाइजर, विष्णु बन जाए, उसमें समुद्र की लहरें आपके दोस्त आएंगे गिराने के लिए, शेषनाग की तरफ फन लोग मारेंगे, विष्णु बन के उसका पालन करें जो ब्रह्मा बन के सुबह डिसाइड किया। एंड बी डिस्ट्रॉयर, शिव का रूप ले लें कि बाहर जितना भी क्रोध, जेलस, एंग्जाइटी बना उसको बाहर ही उसका संहार करके तब घर लौटें, घर वाला बन के लौटें, प्रोफेशनल बन के ना लौटें। अगर ये करेंगे तो हमारे पश्चिम से हमने क्या लिया, ज्ञान विज्ञान लिया, लेकिन वहां आत्महत्याएं बढ़ी। पूरब ने हमें सिखाया, ईस्ट इंडिया ने परम ज्ञान, आत्मक्रांति और आत्म साधना। हमारे कुछ ऐसे डेविड ब्रायंट, स्टीग, कैरोलिन मिस, ये लोग विदेश से आए, हमारे यहाँ अष्टांग योग सीख के गए। ईस्ट एंड वेस्ट को अगर मिला लें तब हम ज्ञान विज्ञान, परम ज्ञान, आत्मक्रांति और आत्म साधना और कई बीमारियों को हम चैलेंज करके हटा सकते हैं। टू कंक्लूड, फॉर बॉडी, इफ यू डू शुद्ध भारतीय भोजन, स्वच्छ जल, व्यायाम और नींद, प्रॉपर हाइजीन, एंड डोंट डू फास्ट फूड, टोबैको, अल्कोहल, सेडेंटरी लाइफस्टाइल, स्ट्रेस, आपके यम, नियम, आसन की प्राप्ति होगी। फॉर माइंड, डेवलप पॉजिटिव इमोशन, दैट इज मेडिटेशन, स्लीप, सो बी सोशल, हेल्प अदर्स। नेगेटिव इमोशन, अवॉइड जेलस, एंगर, डिप्रेशन, एंग्जाइटी एंड स्ट्रेस। अगर ये करेंगे प्राणायाम प्रत्याहार पूरा होगा। एंड सोल के लिए, कनेक्ट योर सेल्फ टू सुपर पावर, थिंक यू आर आंसरेबल टू योर सेल्फ एट द एंड ऑफ योर लाइफ। नाउ एट द एंड ऑफ योर लाइफ यू विल बी able to answer anybody else, nor anybody can ask you। अगर इसको कर लेते हैं तो धारणा, ध्यान और समाधि आपको मिल जाएगी। अगर ये कर लेते हैं, यम, नियम, आसन, प्राणायाम, प्रत्याहार, धारणा, ध्यान, समाधि, अष्टांग योग की प्राप्ति होगी। अष्टांग योग ही दुख निवारण का मार्ग है जिसमें बीमारी भी आपकी दूर रहेगी। और ये एग्जाम्पल मैंने दिया है, स्टीग सेवेंसन, स्वीडिश लड़का है जो अंडर वाटर स्विमिंग में गिनीज बुक हर साल अपना तोड़ रहा है। अभी 25 मिनट 27 सेकंड विदाउट ऑक्सीजन सब जीरो टेम्परेचर में जाता है। उसने किताब लिखी ब्रेदियोलॉजी, जो इंडियन अष्टांग योग का प्राणायाम है। एडवर्ड ब्रैंट, वैदिक टीचर, कोलंबिया यूनिवर्सिटी का हाईएस्ट पेड टीचर है। कैरोलिन मिस, इंट्यूटिव जर्नलिस्ट है, इंडिया आके अष्टांग योग सीख के 7 पावर चक्रा लिखा। हिरोशी मोटोयामा जापानीज है जिसने अष्टांग योग मुंगेर योग विश्वविद्यालय से सीख के वहां जाके उसने किताब लिखी। कॉस्टलीस्ट बुक 1,58,000 की हिरोशी मोटोयामा की किताब आती है अष्टांग योग पे। इंसान की जरूरतें कितनी हैं? मन की शांति, सुपाच्य भोजन और चैन की नींद, बाकी की मेहनत और मुशक्कत दिखावे के सामर्थ्य को इकट्ठा करने में जाया करते हैं। जरूरतें बहुत कम है और जिंदगी बहुत सीमित। अगर ये सब करते हैं, सत्य चित आनंद की प्राप्ति हो, एब्सोल्यूट ट्रुथ, एब्सोल्यूट ब्लिस, एब्सोल्यूट जॉय, आप बीमार नहीं होंगे। जाने से पहले मैं कुछ वर्कशॉप दे के जाता हूं। कितने लोग हैं फॉर बॉडी जो इस तरह से स्क्वेटिंग पोजीशन में बैठ लेते हैं? कितनी महिलाएं हैं जो इस तरह से कर लेते हैं? अगर ये कर रहे हैं तो बॉडी वाइज आप फिट हैं। माइंड, कितने लोग हैं जो प्रेजेंट वर्तमान में जीना सीख चुके हैं? एंड सोल, अगली बार डॉक्टर का कोई प्रेजेंटेशन रखेंगे तो उसमें मैं पूछूंगा, आप अपने से सवाल आज से पूछना चालू कीजिए, हु एम आई, मैं कौन हूं? अगर इस स्थिति को पाते हैं, बीमारी क्या बेसी चीजें, सर्जन एर्गोनॉमिक्स, बिफोर गोइंग टू द ओटी I do yoga pranayam first at my home, and then in between OT, after completion operation theater, are all mates, all surgeons collectively do yoga and pranayam. आखिरी स्लाइड, चलते चलते मेडिकल और सबको मिला के जो मैं कहता हूं, इंसान को आज जो मिल रहा है उससे खुशी नहीं है, इसीलिए बीमार हो रहा है। इसी पे मैंने लिखा था, जो मिल जाए वो मिट्टी है, जो पा न सके वो सोना है, निर्मल मन हो जा रे मानस, सब कुछ एक दिन खोना है। माया और प्रपंच भंवर में निर्भर किस पर होना है, कर सको कुछ कर लो बंधु, नित दिन तेरा रोना है। पीछे छोड़कर रिश्ते नाते पंच तत्व में जाना, वही 5 एलिमेंट जहां से प्रेजेंटेशन स्टार्ट हुआ, क्षिति जल पावक गगन समीरा। पीछे छोड़कर रिश्ते नाते पंच तत्व में जाना है, राम नाम का बीन बजाकर बस स्वाहा हो जाना है। फिर भी उलझन क्लिष्ट जीवन और तेरा कटु व्यवहार, चित्त भेदती हृदय चीरती तीक्ष्ण रुक्षण नरसंहार। समाधान क्या है? सरल सादगी जीवन यापन, नित दिन ना हो मारम मार, प्रेम भाव दया कर्म सहिष्णुता और परोपकार। प्रकृति स्नेह मधुरवाणी, संतुलित और सरल विचार, मझधार ना आएगा आड़े, हो जाएगी नैया पार, हो जाएगी नैया पार। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। धन्यवाद।
Dr. Anshuman, I'm like really blown over. What an amazing presentation. And I must share with the audience कि जो Dr. Anshuman Kumar ने जो presentation दी है, वो बहुत ही simply उन्होंने बहुत से जो deep Vedic जो truths हैं और बहुत ही किताबों से जो सार निकाल के उन्होंने इतनी simple भाषा में explain किया. I'm really blown over because ये बहुत deep Vedantic philosophies हैं जो उन्होंने बताई हैं in a very simple. When I say simple, matlab doable. They are doable. None of this is like something which cannot be done. And now we are open to questions. Please, I would request Kanika ki jo bhi audience se questions aa rahe hain, can you please start sharing the questions?
Ma'am, an anonymous attendee has shared a question that a person with HER2 positive cancer presently on letrozole 2.5 mg and her ovaries have been removed due to a precautionary measure, and she's having hair thinning issues due to the medicine, and she wants to know that if PRP for hair is safe for her because it is slightly invasive, and her oncologist is telling her that her problem is hormonal, and the dermatologist is asking her for a PRP, that is for the hair growth factor.
So Dr. Gurdeep Sethi, would I request you to take this question?
Sure. I missed the first part. So this patient is on active treatment, correct?
Yes, sir. And she's taking letrozole 2.5 mg and her ovaries have been removed due to a precautionary measure.
Fair enough. How old is she?
Sir, the age is not written.
Okay, fair. Well, so letrozole technically is an aromatase inhibitor. It with the ovaries gone, 10% of the estrogen is produced by your adrenal glands. And if it's a breast cancer, ER, PR positive, then letrozole is the right choice. Letrozole doesn't cause hair loss. So if she has hair loss, she can use any kind of therapy, oils or PRP or whatever she wants to do. Not a problem at all. I don't have an issue. Doesn't cause cancer in any way. Okay. But I think what Dr. Anshuman said, all that stuff, mind-blowing. Listen to him, follow the diet, follow the chart, follow the sleep, mind, muscle, memory, everything perfect. Just do that. I think all that will help faster than other stuff that we do. But yeah, there's no inhibition at all. Feel free to use PRP, feel free for hair growth of any kind. Not a problem. Okay.
Dr. Sethi, there is another question. People are asking, where is the Phantom test available? And if you could just...
Well, Phantom test today is available at Millennium Cancer Center. It's available at Vedique. We're tying up with Core Diagnostics, so they'll also be coming in. CK Birla hospitals have lined up. UK Nursing Home in Vikaspuri has lined up. So there are different sites, but generally, if you just reach out to us, reach out to our team, Shiv will take care of it. Anywhere in NCR, we can take care of. In fact, we've tied up with Sterling in Gujarat, Bhopal. We've tied up in Imphal, different places, different centers are tying up, and they've started the program. But any questions, anybody wants Phantom, just reach out to me. My number and everything's available. We'll organize the team. Shiv from our team will take care of it. Okay. But Shikha, you should have it on your program too.
Yes, we have it with us also. So yes, we will be, in fact, after the session, we'll be sharing the details of the hospitals and the doctors who have who are our panelists, so that you can reach out to them, you can reach out to us, whatever is convenient. There are two more people who have raised hands, Suresh, Lala and Anubha. So Kanika, can you have their questions, please? Suresh, Lala and Anubha, they have raised their hands.
Ma'am, Miss Anubha was asking for a cancer diet. So I've shared that Dr. Seema Puri in the next session will be sharing superfoods for cancer. And we have another question by Miss Dipali Ingle, that can a person with autoimmune disease follow this and having a lot of pain in overall body all the time?
So the question, can a person with autoimmune disease follow what Dr. Anshuman is saying? I think 100%. And follow the diet that Dr. Seema or Dr. Shikha's team put in, I think should be fine. But if the person has autoimmune disease and is on active treatment with immunosuppressants of any type that suppresses the immune system, then to do a Phantom test, that he or she doesn't qualify. We're using your own macrophages, which is part of your immune system, to do the internal biopsy, and we are staining those macrophages with a special protein to see if you have tumor. For Phantom, if your immune system is off, if your macrophages are low, the sample will be rejected. So when we when we take you for the Phantom test, we go through a questionnaire, and if you have any of these questions which tells me your immune system is off, then we tell you, don't waste your money. Your test will be rejected. Wait until you get off medicines, then we can talk. People with rheumatoid arthritis, people with Crohn's, not on any active treatment, who have been disease-free and just taking hydroxychloroquine, is okay. But if you're taking, methotrexate, azathioprine, corticosteroids, the immune system is going to be off. There we reject the samples.
So we have another question from Dr. Shivam. He's asking that can we decline Phantom reading with lifestyle and dietary modifications in high-risk patients? And if yes, how long would it take to reduce the Phantom score?
So many of the patients, I won't say patients, clients or customers, they are regular customers for blood tests. When we did the study in India, we looked at the first 60 healthy people that I saw, 60 to the first 120. 70% were at the high risk of 250 to 260 zone. Okay. So I asked the Germans, this is Hendrik, how many people in your population when you did the study were in this high zone? But there are a lot of people, 255, 258, 259, calling again and again, Dr. Sethi, 260 is the cutoff. I'm 259. Mera hai ki nahi hai? You see? So then Hendrik says, Dr. Sethi, why don't you get healthy people? I said, these are healthy people. So we went and got 60 people from the army. Our CEO was Colonel Harjeet. He went to his battalion. So 60 Jawans came up and all their scores were less than 245. We realized sitting in Delhi, we sit. And then we are smoking 1 pack a day with the environmental air. And then we eat junk food and we drink alcohol and we smoke. So these risk factors, when we started defining and asking them to cut down those risk factors, the scores came down to 252, 250. Everybody's, tension went away. So that I used to have a green zone less than 245, gray or orange zone 245 to 260, and then the red zone positive. So gray zone wala kamna, too many questions came. I said, look, positive or negative, there's no more. But that gray zone is your wellness sector. That's the one you need to follow Dr. Anshuman's program. All right. Should Hindi, it's beyond my mind. But the M and sleep,
Yes.
I like that. I like that. Okay. Follow that. Those are lifestyle changes. Healthy eating, sleep well, less stress,
But
enjoy.
Dr. Gudeep, we can do that. Gray zone people that can be randomized or no intervention or MMS intervention and redo the test after 6 months or 1 year.
Why do you want to put no? Why do you want to put them no intervention? Sabko karo MMS. It is healthy. It's going to
Right.
help them.
Right.
See, my risk, the questionnaire that I have, the risk factor questionnaire, multi-cancer risk assessment questionnaire, has the same points you've talked about. And
Exactly.
we haven't talked in 10 years. Last I met Anshuman was 10 years ago when I came in the beginning with IOSPL.
Right.
After that, we haven't talked. He went his way, I went my way, and we've just come across out here. What a pleasure.
Right.
Lovely.
Thank you.
Very well done.
Thank you.
So I have one question for Dr. Anshuman. Dr. Anshuman, suppose somebody has already undergone mastectomy and has undergone all the cancer treatment. How much would the what should they do so that the relapse doesn't happen, or is relapse possible, like a double mastectomy 3 years back?
Yeah. Considering it's not a genetic cancer, means BRCA positive, considering, because majority are non-BRCA cancer in India, 5 to 10%, 15% are BRCA positive cancer. Even for those people, this lifestyle modification should be a part of the program. But unfortunately, our majority of the hospitals, they are not taking that program. Why I'm saying this? कैंसर का इलाज कर दिया, ऑपरेशन कर दिया, कीमोथेरेपी दे दी, ये वही फिनोमिना है कि कहीं पे धुआं दिखा, हमने पानी धुएं पे छिड़क दिया, लेकिन आग कहीं लगी रह गई, 2 साल बाद फिर से धुआं निकलने लगा. मीन्स वी आर नॉट किलिंग द रूट कॉज. कैंसर बना क्यों था? तो अगर फीमेल का वेस्ट सरकमफ्रेंस ज्यादा रह ही गया, आपने ट्रीटमेंट कर दिया, प्लांट बेस्ड फूड उसने नहीं लिया, एस्ट्रोजन प्रोजेस्टेरोन डिस्टर्ब रहा, तो फिर आपने किया क्या? बिकॉज आर ट्रीटमेंट मेथोडोलॉजी, सर्जरी, जीरो डॉट काइनेटिक्स डाउन कर दिया, कीमोथेरेपी, इम्यूनोथेरेपी, जो भी नॉर्मलिटी एट सर्कुलेटिंग ट्यूमर सेल के लेवल पे था उसको करेक्ट कर दिया, लेकिन अब फर्दर ना बने इसके लिए ये फॉर्मूला, फूड इज द मेन कॉन्ट्रीब्यूटर 35%. इसको चेंज करना है, लाइफस्टाइल चेंजेस, जिसमें वेस्ट लाइन शुड बी लेस देन चेस्ट लाइन. एक P50 रिहाइपरमिथाइलेशन कच्ची हल्दी का रोल है, ये एस्टेब्लिश हो गया. रेस्पेरेट्रॉल जो ब्लूबेरी और ब्लैक ग्रेप्स में है, कॉपर विद रेस्पेरेट्रॉल का रोल कंफर्म हो गया कि फ्रेगमेंटेड क्रोमैटिन जो रिलैप्स के लिए रिस्पॉन्सिबल उसको कम करता है. इसको अपने लाइफस्टाइल में इंक्लूड करना है. वी कांट इग्नोर फूड. हिपोक्रेट, इवन मॉडर्न मेडिसिन के फादर ने कहा था कि ईदर टेक फूड एज मेडिसिन और यू हैव टू टेक मेडिसिन एज फूड. तो देयरफॉर ट्रीटमेंट के साथ भी होलिस्टिक अप्रोच चालू करना ही पड़ेगा. इंटीग्रेटिव ऑन्कोलॉजी इज द आंसर ऑफ द एरा. अदरवाइज वी कैन कीप ऑन, जितने पैसे डाल दो, डॉक्टर गुरदीप अग्री करेंगे, 17.8% ऑफ यूएस जीडीपी इज गोइंग फॉर हेल्थ केयर बजट, एंड स्टिल हेल्थ केयर ऑफ यूएस इज गोइंग टू ब्लैक होल. इंडिया का बजट तो 1.9% से ऊपर नहीं जा रहा है आज तक. तो हमारे पास पैसे नहीं होंगे. अगर हमने इंटीग्रेटिव ऑन्कोलॉजी, होलिस्टिक हेल्थ केयर की बात नहीं की, तो हमारे पास पैसे नहीं होंगे, हम बचा नहीं पाएंगे लोगों को.
No, absolutely, and so well said. And I think I want to just point out to all the audience here, कि today on the panel, all the people are actually those people who are earning from treatment and yet saying कि treatment तक मत पहुंचिए, prevention. So I can only applaud this. ये जज्बे को मैं सिर्फ applaud कर सकती हूँ, because most people think that doctors are not fond of prevention, but doctors are actually dedicated to prevention, and I want to just highlight that. So we would be sharing the details of the doctors to all the people who have attended. Please make sure that you share your email IDs or your numbers so that we can send the details. And I'd like to thank both our panelists for such a brilliant time. Even I have been learning so much, and we will keep bothering you again in the times to come to share your knowledge. And thank you so much. And now I'd like to invite Dr. Seema Puri.
We have 2 more questions.
So Kanika, we can have those questions later, because Dr. Seema Puri would be also wanted to invite her. Yes. So can you just put up the presentation, Kanika?
We've shared, ma'am.
Yes. So Dr. Seema Puri is a nutrition consultant and professor. She just retired from the Institute of Home Economics, University of Delhi. She has 40 years of teaching and research experience at Institute of Home Economics, Delhi University. She is a PhD in nutrition, University of Delhi, MSc in foods and nutrition, Lady Irwin College, University of Delhi, and a BSc in home science honors, Institute of Home Economics. Dr. Seema Puri I have known for many, many years, and I have taken her advice when we were creating the OneHealth nutrition program. And she has been very generous with her time. And she loves research, is what I have understood. She's very, very keen on putting evidence behind things which we know for sure, but but we don't really do research on those things. But Dr. Seema Puri has a wonderful research-oriented approach to health, and she'll be talking about superfoods in cancer. So, Dr. Seema Puri, your dais now.
Thank you so much, Dr. Shikha. It's always a pleasure to interact with you, and it's wonderful to be here. And I must compliment the previous speakers. Amazing presentations, and one could just keep on hearing them. So it's really a pleasure to be here, and I will share my slides. I won't take too much time because we're already running late. So I'm going to talk about superfoods in cancer. And are you able to see my slides?
Yes, please. Yes,
Okay,
please. It's visible.
Yeah. Okay, so I'm going to talk about superfoods in cancer. Of course, as Dr. Anshuman said, there are many foods which have beneficial properties in various diseases. I've tried to cull out the information regarding their role in cancer and maybe dispel some myths. I'm not talking about, like somebody put a query about what diet should be consumed. I think Dr. Shikha's team is very well equipped to handle any questions relating to prescribing diets during various diseases. So we'll talk about a more generalized approach. And so what are superfoods? So superfoods is basically a term which is coined by the market. And so it's supposed to be a food which gives various health benefits because of its exceptional constitution. So whether it's nutritional or its other constituents like antioxidants or phytochemicals and all. So there are some health benefits which come from that. And it's not commonly used by dietitians or nutrition scientists. And it's mainly used in the market on social media as a selling strategy. But if you look at them closely and look at the group of foods which have been classified in this category, they are generally nutrient rich. Per calorie basis, they are higher in nutrients. So they have low calorie density, but exceptionally high nutrient or phytochemical constituents. And because of that, they confer various health benefits, whether it's anti-mutagenic, dyslipidemic, building up the immune system, reduces inflammation, various other benefits, digestive health, etc., etc. And a lot of these, everybody got very conscious about post-COVID because there was so much focus on immunity, on maintaining health, that consciousness among the larger population has really, really increased in the last few years post the pandemic. So as I told you, they are generally nutritional density is very high. They are very rich in vitamins and minerals, maybe antioxidants, in fiber, in omega-3 fatty acids, in other phytochemicals, and so on. And these are some examples. The list is endless, of course, but broadly, interestingly, there was a study which was done in 2023 where they went through all the documentation, 3 search engines to identify which superfoods are there. And they were able to identify about 135 superfoods from literature. So that's a big, big bucket list. And I've tried to categorize some of those which were the most popular ones which were reported, which are, of course, the greens and the berries, and avocado, the fish, nuts and seeds, spices and herbs, things like green tea, legumes. And as we can see from this list, that most of them are rich in antioxidants. Antioxidants, most of them have a very high polyphenolic content, And then like the seafood, etc., the walnuts are rich in omega-3 fatty acids. So they seem to have some common constituents which they are rich in, which confers them the health promoting properties. So before we go on to the different types of foods, of course, like I said, it's a bucket list. I can't deal with all of them. I've taken some kind of representative samples of some foods and talking about them. So since most of them contain antioxidants, we know that antioxidants prevent free radical damage. But there are also studies to show that while antioxidants may be protecting, in some cases, they also promote cancer development. So we should not blindly follow. So these are the protective roles that I'm listing in this slide. So there's free radical damage, because of pollution, because of, as Dr. Anshuman said, a lot of negative things in the atmosphere. Our body develops free radicals, and antioxidants help to counter that. Certain risks of certain cancers are diminished, but on the other hand, some are increased. And we know that vitamin C, beta carotene, selenium, these are the common nutrients which are antioxidants, and they help in cancer therapy. They're also lower the risk of certain cancers, and they help in alleviating the side effects and maybe the outcomes of certain cancers. But if you look at the negative roles, some of the antioxidants, they promote tumor growth and and metastasis. The very high dose of supplements during cancer treatment may interfere with certain therapies which are done. And sometimes cancer cells use oxidative stress for survival. And therefore, the antioxidants may inadvertently protect the cancer cells from treatment-induced cell death. So therefore, there are studies which are for the use of antioxidants in cancer, and there are some studies which are contrary, which show that antioxidant supplementation can increase cancer incidence. So at the end of it, the message that is very clear is that we should eat an antioxidant-rich diet. That means it should have very colored fruits and vegetables, but particularly because different colors will have different types of phytochemicals, and not rely on supplements as a therapy. So that's what I said. There's a paradox. And that the antioxidant paradox, like I said, is sometimes the antioxidants are beneficial because they're highly active. They react with these nucleic acids, lipids, and proteins. And on the other hand, that you have to maintain a delicate balance between antioxidants and free radicals, because free radicals are also beneficial to health. And therefore, the natural antioxidants are what are important. And this is what I've just said earlier also. The second constituent which many of the superfoods have is dietary fiber. And we know that fiber is a functional food because it's not only regulates the gut, and today we have a lot of studies to show that the gut is the core of health of all our body. There is a gut-brain axis. There is, it kind of governs nearly all the organs of our body. So the risk of chronic disease is much lesser if you're having a high fiber diet. And we know that certain types of fiber help to control blood cholesterol, blood glucose, certain cancers, and legumes particularly, the pulses. And fortunately in India, we eat a lot of pulses. They lower the risk of some types of cancer because they are rich in soluble fiber. They're also rich in certain other things like lignins and all. And there's a study which showed that people with high bean fiber diets were 20% less likely to develop breast cancer than those who did not meet their fiber intake. Fruits and vegetables, there's a lot of hype about fruits and vegetables. And what is important here that we eat a variety of fruits and vegetables, because when you eat a variety of fruits and vegetables, you get different types of nutrients and different types of constituents like fiber, antioxidants, the color pigments, the anthocyanin, the beta carotene, the lycopene, allicin, all these have health promoting properties. And studies have shown that an adequate fruit and vegetable intake will lower the risk of certain cancers. especially of the gastrointestinal tract, the lung, pancreas, prostate, etc. And among these, the cruciferous vegetables, which are the cabbage and the broccoli and things like that, they contain a compound called sulforaphane, which significantly inhibits cancer cell growth, and it's very beneficial in colon cancer because it destroys the colon cancer cells. When sulforaphane is combined with genistein, it seemed to be beneficial even for reducing or breast cancer development. So besides the cruciferous vegetables, we have the dark green leafy vegetables. The darker the green color, the better it is. Soya products I just mentioned. We all know about the benefits of garlic. So the allium vegetables, which also includes the onions, the legumes, and tomato because of its lycopene. And the experts recommend at least 400 to 500 grams of vegetables and fruits every day, which works out to at least 1 cup of fruits and 3 to 4 cups of vegetables as a cancer prevention strategy. Another fruit which is very often talked about as a superfood is berries. And berries, because of their rich color, they are rich in the antioxidants and the phytochemicals, besides the vitamins, minerals, and fiber. And the digestive cancers, it has a beneficial effect. It also helps in the immune system, but not all berries, some of them. And like in raspberry and cranberry, there is cyanidine, which reduces the activity of cancer-causing genes and boosts the activity of cancer-stopping genes. But again, like I said, a lot more research is needed. In fact, for most of these superfoods, it's research in progress. And we will, we are hoping to get more and more confirmatory data as we go along. We always heard about dark chocolate being beneficial. Now, dark chocolate does contain polyphenols, flavonoids, and antioxidants. And some studies have seen that people who ate more dark chocolate had a 12% lower risk of death from cancer. Whole grains. Again, whole grains are also rich in fiber and other nutrients, and most of the nutrients are in the outer protecting cover. And that's like your brown rice, your quinoa, oats, and all that. And the phytochemicals, which are located in the outside matrix, is what is responsible for the reduced risk of disease. And therefore, the dietary guidelines for Americans recommend that half of the cereals which you eat should come from whole grains and not refined grains. So what do they do? Besides the lowering of cancer risk, they also improve the bowel movement, they improve satiety, they improve all your metabolic parameters, including anthropometry, blood pressure, lipid profile, insulin sensitivity, inflammatory markers. There's a study which shows it reduces depression, and as such, it reduces all-cause mortality in various studies. And consequently, a high consumption of refined grains has been associated with a high risk of gastric and colon cancer. Spices and herbs. We have a very large repertoire of spices and herbs in our country. And the difference between spices and herbs, sometimes they're used synonymously, but spices are different plant parts, which include the bark, the flower, the roots, seed, nuts, fruits, etc. While the dried leaves or the fresh leaves are what are called as herbs. And in tradition, in Ayurveda, Dr. Shikha's group are experts in this. There is a long historical use of herbs and spices for various diseases. And that's because of their very large bioactive constituents. And mainly sulfur containing compounds, tannins, alkaloids, and the flavonoids, polyphenols, and the vitamins. Now, various different spices have different antioxidant, anti-inflammatory, anti-tumorigenic, anti-carcinogenic effects, as well as glucose, cholesterol-lowering activities. Recent data has also shown that it affects cognition and mood. And we do know traditionally that it's very important for gut microbiota. Okay, so we find that a frequent consumption of spicy foods was also linked to a lower risk of death from cancer, heart disease, diabetes, and respiratory diseases. Okay, so these are all the health benefits of spices. Various spices have different roles to play, and we don't have so much time to go into all of them. I've tried to list them very broadly. So anti-carcinogenic, there's a whole plethora of spices, anti-diabetic. We know cinnamon, garlic, fenugreek, very well established, anti-diarrheal. Traditionally, we all know this. Even for immunity, we have clove and black pepper, garlic. Dental health, anti-inflammatory, which came in very popular during COVID times. So everybody was having the kadha every day, and we had the turmeric latte, which became a hit. All these have properties which are disease preventing. I'm going to talk about one or two only as an example. I can't go through all of them. So turmeric. In fact, it's interesting. I read an article somewhere which said that India was not so impacted by COVID as compared to, say, Europe, considering the number of deaths and all that, because we were traditionally having a lot of turmeric in our diet. So I don't know how true that is or whether it's supported by data, but this was an observation by some expert. So turmeric is, we know it's anti-inflammatory. The haldiwala doodh has traditionally been given whenever a child fell down or you had some, cough and cold or you hurt yourself. The first thing was give haldiwala doodh. So it's anti-inflammatory. It's antioxidative. There are studies to show that curcumin, the active component in turmeric, reduces the serum cholesterol levels, increases HDL levels, in fact, even has a blood glucose lowering effect. And gastrointestinal effect, we know it's also helpful in non-alcoholic fatty liver disease. And it's also said to help in brain health and anti-depression. So giving 1,000 milligrams of curcumin every day, which is a large quantity, was found to have a beneficial effect for patients who are depressed. And because of its anti-inflammatory effect, we know it's used for the management of joint disease, arthritis, joint pains in old age. In terms of cancer, there are studies to show that curcumin inhibited the proliferation of various tumor cells in culture. It prevented the carcinogen-induced cancers in rats and growth of human tumors in various models. But yet it has not been investigated in humans to get us very strong evidence, but traditional literature does show that. The next category is nuts and seeds. And nuts and seeds, again, regular consumption of nuts and seeds is associated with a lowered risk of overall cancer and some specific types like gastric, colorectal, pancreatic, endometrial, and lung cancer. Again, here there are various bioactive compounds, which are the polyphenols, the fiber, vitamins, and minerals. And some specific nuts and seeds, I'm just highlighting walnuts. We do know walnuts are also rich in omega-3 fatty acids, but they also have a component which can reduce cancer mortality. Peanuts are a source of resveratrol, which Dr. Anshuman also mentioned, generally found in grapes and red wine, which helps in cell death and therefore may be beneficial. Cashews contain a phenolic acid, which is also found to be beneficial to prevent epigenetic alterations. And then, of course, all the phytochemicals, whether it's ellagic acid, flavonoids, they are tumor suppressants or they inhibit tumor initiation. And the phytosterols also have been shown to reduce cancer risk, especially of the colon. Besides that, they have anti-inflammatory and antioxidant effects. They inhibit cancer growth, cell growth, anti-angiogenesis, so new blood vessels are not formed. They improve the immune function. They modulate the gut microbiota. And besides that, they alter the lipid profile and cell metabolism also. Then we have probiotics, prebiotics, and symbiotics. So, like I said, today we know that the gut is the basis for a lot of diseases. An inflamed gut or dysbiosis in the gut can lead to a number of diseases varying, not only gut-related, but even metabolic diseases, even brain diseases, cognition, etc. And therefore, probiotics, prebiotics, and symbiotics are what come into play. So probiotics, we all know, are live microorganisms taken in adequate amounts. Prebiotics are indigestible fermented food substances, so generally rich in fiber and oligosaccharides, fructooligosaccharides, and so on. And they, when they go into the gut, they promote the multiplication or growth of the desirable bacteria. So we also, I'd like to just put a word of caution here that when we say probiotics, we say, yes, fermented foods, they do contain some amount of live bacteria, but to confer the full health benefit, we have to have specific bacteria in specific amounts. And that then comes from a probiotic formula, whether it's a drink or a milk or a curd or whatever, which is manufactured and with a known number. The curd that we make in our homes, the constitution would vary from home to home. And therefore, we cannot say it's a standard probiotic. Prebiotics found in food would include things like banana, asparagus, garlic, onion, soya bean, oats, etc. And they found that when prebiotics and probiotics are given together, which is known as symbiotic, then the tumor incidence was much lower in animal models. So to give you an example, also, it's not only foods. Like I've been saying, it's important to consume these foods as part of your diet. So there was this study where they considered what was their perception of a healthy diet with the Mediterranean diet, which is hyped as a very, very healthy diet. So there was a diet which had plenty of fiber, had limited amounts of saturated fat, animal protein, and refined sugar. And the Mediterranean diet, in addition to all this, also had the inclusion of red wine, and they used the extra virgin olive oil. Now, when they had these two, they found that both these eating patterns had a protective role against the development of breast cancer. So it's not only an individual food, I would say, but it's the composition of the entire diet, which even like Dr. Anshuman has been highlighting, your diet, your lifestyle, which would contribute to leading a healthy life and being free from disease. So in breast cancer, which were the foods which would be included? Again, they had found that it was soya because of the phytoestrogen content, which was beneficial, but taking supplements which contain phytoestrogens was not really showing any beneficial effect. Again, high lignin consumption, which lignins mainly come from your seeds, like flaxseed and oil, dietary fiber. They also found an inverse relationship between mushroom consumption. But the role of green tea in preventing breast cancer was a rather weak evidence. So there are some foods which we must include as part of your healthy diet, which would be beneficial for protecting us from the risk of cancer. But I would also like to say here, which both the earlier speakers have said, that it's a multiple risk factor. Dr. Sethi highlighted 8 factors which are modifiable. So it doesn't mean that you follow a healthy diet, but you don't do any activity and you're obese and you're exposed to pollution and all other kinds of contaminants. And then, that the diet doesn't work. Okay, so to kind of put it all together, which are the main foods which would be cancer protective? So fruits and vegetables, whole grains and legumes, dairy products, very contrary evidence because there is some which have lowered risk of cancer, but some have also said that it doesn't show any effect. Healthy fats like nuts and seeds and omega-3 fatty acids and lean protein. Now, when you say some foods can prevent cancer, like I just said, this is a myth. Okay, it's the lifestyle, and there are so many other components in the lifestyle. So we cannot say, and it's also the complete diet pattern that the person is having. So there's not enough evidence to suggest that there is any one food that can prevent the development or progression of cancer. So to title that, say, whole grains are a superfood to prevent cancer would be incorrect, because whole grains in combination with the rest of your lifestyle and your diet would, yes, benefit in reducing the risk of cancer. And when I say it's reducing the risk and not reducing the incidence. So like superfoods, the list is endless for some of these claims, but for most of them, the research in human beings needs to be done. More research needs to be done, more robust evidence needs to be coming in. So at the end of it, I'd like to end by saying that in your diet and in your lifestyle, we have what we call the mantra of balance, variety, and moderation. So eat food in a balanced way. Proportions are very important. Portion sizes are very important. Eat till, Japanese say hara hachibu. They're famous for longevity. And they have this mantra of hara hachibu, which says eat only till your stomach is 70% full. So balance is important, variety. Eat a variety of foods. Eat different colored fruits and vegetables. I always say eat 5 different colored fruits and vegetables every day. If you even keep that in mind and make a conscious effort of doing this, it's not difficult to do, but it's just something we don't think of. And today's younger generation thinks the only vegetable they eat is potatoes, unfortunately. And then moderation in your lifestyle, whether it is food, whether it is activity, whether it is, stress, whether it is habits like alcohol, everything has to be done in moderation. So if we follow balance, variety, and moderation, I'm sure, the superfoods, definitely include them in your diet, but don't make them the sole source or don't depend too much on them. Thank you very much.
Dr. Seema Puri, thank you so much. And I'm so glad you mentioned that, because many people are looking for a quick fix. A lot of people think this is the new Sanjeevani Booty. You just have this food and then you are done and you can keep smoking. You can you cannot follow anything what is being told. And I'm so glad, because most people think there is a magic bullet to everything. And this you have clarified. So we are now happy to take questions if there are any. Kanika, sorry, help me out. Are we taking questions now or later?
Ma'am, we'll take the questions later. First, we would like to have Dr. Akanksha Bhatia's session.
Yes. So can you please put up the slide?
Yes, ma'am, is sharing it.
Dr. Akanksha Bhatia, it's a pleasure for me to introduce Dr. Akanksha Bhatia. Dr. Akanksha Bhatia is a counseling and educational psychologist and the founder of Manrahi. She has done her BA Honours in Psychology from Indraprasth College, Masters in Psychology from University of Delhi, and a PhD in Psychology with a UGC Senior Research Fellowship from the Department of Psychology, University of Delhi. And she'll be talking about emotional wellness during cancer. So over to you, Dr. Akanksha Bhatia.
Thank you so much, Dr. Shikha. It's my pleasure to be here. And I think I was just hearing other speakers speak, especially Dr. Anshuman and then Dr. Seema. I think for me also it has been quite a learning experience. So thank you very much for that, to have such wonderful speakers. I'm just sharing my screen. Can someone please confirm if it's visible?
Yes, please. It's visible.
Today, I will be talking about the emotional wellness during cancer and how we can empower the patients as well as the caregivers. So the first thing I want to start talking about is with the cancer diagnosis. I think that is where it actually hits the patient. And once that diagnosis comes into the picture, it is actually in most cases, and that is what I have seen as a counseling psychologist for the past 12 years, that this becomes a life-changing event for them, and they usually define their lives before my cancer diagnosis and after my cancer diagnosis. It affects the identity of an individual, their self-image, and even the sense of control, because they feel I don't know what to do now. I'm not sure if I have the kind of control. To top up that, we already know that in our country, unfortunately, cancer, still brings out a sort of a stigma to some extent, and there are sections of society which still feel that, okay, नहीं पता अब क्या करें, अब कैसे treat करें, क्या करना है, right? All of that situation comes up. The most important thing here that I would like to talk about is something called as a PNI approach that we usually talk about during our counseling as well. This is called a psychoneuroimmunology approach. So now what happens in the psychoneuroimmunology approach, also known as the PNI approach? The psycho, यानी कि the mind, जो आपका mind है, neuro यानी कि जो आपका nervous system है, and I, which is your immunology, ये तीनों आपस में related है. In fact, apart from that, even इसमें हम एक और बात भी बोलते हैं, endocrinology, right? So आपका जो hormonal system है वो भी affected है. And I think now it's not a rocket science. आप इंस्टाग्राम पे चाहे रील्स देख लीजिए, चाहे कहीं पे भी देख लीजिए, डॉक्टर्स विल टॉक अबाउट दिस, दैट देयर इज अ वेरी वेरी स्ट्रॉन्ग बॉडी एंड माइंड कनेक्शन. There is a strong connection between how you are thinking, how you're feeling, your stress levels, as well as the way your immune system is going to respond, your nervous system is going to respond, right? Your amygdala here, how it will respond to the kind of stress, ये बहुत एक common connection है जिसके बारे में हम बहुत ज़्यादा आजकल बात करते हैं. So what is very important during cancer is that if you are able to keep the patient in a little better emotional health, I'm not saying the best of it, they may learn to cope, because coping mechanisms don't develop over a period of a day. They will take their own time to build their coping mechanisms. After all, it's a very, it's a big thing for them to go through this kind of an experience. But so once that is happening, once the emotional health is taken care of, you will see that there are better recovery outcomes. They adhere more to the treatment and they report less anxiety, less stress. Their pain perception also reduces, and we see that they are responding better to the treatment, as well as they report an overall quality of life in a better way as compared to the patients who do not receive any emotional support along with it. In fact, ये इतना ही है कि अब psychology में, counseling में, we have a specific segment called as psycho-oncology, where psychologists are being trained to deal with, the care of patients who are going through cancer, as well as to also look after patients, as well as to look after the caregivers of the cancer patients as well. So there is an entire branch of psychology which is called as psycho-oncology. So let's talk about some of the social emotional challenges which we usually see, and these are all the challenges which I have kind of taken from the clients that I have counseled, right? The biggest challenge is the fear of death. There are uncertainties, the body image challenges that they face, the loss of independence, of course, depression, stress, anxiety, and isolation. As I was saying, the role of society, the role of how people around them, that is very critical, because most of the people that I have spoken to, most of the cancer survivors, they say that, we feel isolated. We don't, there are people who come to us, they talk to us, but usually we feel isolated. Then the treatment side effects, of course, the chemotherapy is very, very, tiresome for the body. There are something that I personally call social side effects. Now, what are social side effects? These are unsolicited advice. जो family members आके, relatives आके, they start talking about आप ये कर लीजिए, आप वो कर लीजिए, without realizing, without being empathetic enough to understand the situation of the patient. They would just keep, and I'm not saying that they mean it in bad intent. They don't. Most of the times they have a good intent, but the way it is communicated at times is not something which the patient wants in that moment. The patient wants more support, more just listen to me. I know I'm dealing with this and I know I'm going to come out of it, but just listen. I just want someone to validate what I'm feeling. Then sometimes there is also, they start asking questions which are more, I would say, out of curiosity rather out of concern. And that also can be a big social side effect. And last but definitely not the least is the financial anxiety, because there is a financial burden that patients go through, and that is why it has been named social, emotional, and even economic challenges that have been faced. So now, what is the first thing that we usually do when, as a counselor or as a psychologist, what we usually aim at doing is to kind of change the narrative. See, mind is something which is extremely, extremely powerful. any battle, if you have to win in life, be it the battle with cancer or any other battle, any battle, I would say, is fought twice. Once it is fought in your mind's battlefield, and then second it's fought on the actual battlefield or wherever you want to fight. And we know it, even the Krishna and Arjun story says the same, कि पहले अर्जुन को अपने दिमाग को एक वे में सेट करना पड़ा था, उसको मेंटली प्रिपेयर होना पड़ा था, यानी कि माइंड में उसको बैटल विन करना पड़ा बिफोर ही कुड एक्चुअली गो आउट एंड विन द बैटल. सेम सिचुएशन हमारी लाइफ में आती है. जब भी यू विल सी anybody facing any challenge, you have to first figure it out in your mind what you can do. And usually this diagnosis becomes such a jolt, such an emotional jolt for the cancer patient, that they feel completely, oh god, main kya karu? So what we need to do is to change that victim mindset, which we see in 90% of the cancer patients, that they get into the victim mindset and shift that narrative and become into a warrior mindset. So एक सबसे ज्यादा आई थिंक जो क्वेश्चन मैंने सुना है वो आता है, व्हाई मी डॉक्टर, मेरे साथ ही ऐसा क्यों हुआ, right? And sometimes it happens that I was not taking bad diet, and I was trying to lead a good life. I'm not a smoker, I even don't take alcohol. Why did it happen with me? And honestly, we don't have any answer, because as even the doctors have said, there are multiple risk factors. They could probably just be a genetic factor, right? So how do you change that mindset? You start talking about, it's okay, it has happened, now you can't change. So acceptance needs to come. But after acceptance, the first question is, what are you learning from this experience? Ye experience mujhe kya sikha ke jayega life se? The second thing that they keep talking about is, I cannot control this. Right? And then what we try to, to kind of shift the narrative by saying, it's okay, ho sakta hai aap nahi control kar pa rahe, but you can always control your response to the situation. You can't change the diagnosis, but you can change the way you are taking that diagnosis, and you can change the way how you are going to be responding towards that diagnosis. And instead of feeling I'm very helpless and alone, which is again a very common feeling that people go through, probably a very good team of medical experts, professionals, and even the family and friends support can actually make them feel that, no, we all are there for you. And we all will be supporting you in this journey. And we will keep fighting till you don't come out, with flying colors out of the situation. So I always like to give example of Yuvraj Singh, and why I give example of Yuvraj Singh is because, of course, he has been a warrior. Of course, he went back to playing cricket after his cancer diagnosis, but he's also a very, very strong vocal advocate of mental resilience. So another thing that we need to do here is that the cancer patients probably should be encouraged more, and that I'm not saying it would come in a day or two. It might take a very, very long time for them to reach that point where they feel a little comfortable about talking about their experiences. So the question over here, or maybe the thing that we probably should encourage, is to find your voice. Whenever you are going through a bad experience, you always feel, you go through many negative emotions, but what are these emotions teaching you? Number one. And number two, can you use these experiences to now, help somebody else who's also going through this? So if you're able to find your own voice, right, in this experience, and you're able to also start educating others, or start at least just providing support. I'm not saying just go and start psycho-educating, but provide support. You say, yes, even probably, yeah, I can understand, I can relate, and in this world where everyone is so lonely, I think everyone would want somebody who can relate. अगर मुझे कोई ऐसा मिलता है जिसके साथ मैं relate कर सकती हूँ, that I think really, really helps. So the support, and I will be talking about support groups also, with the same intention that people need to come together as a community. People need to support each other as a community. And in some, cases we have seen, in fact, one of my, clients whom I was dealing with, and it's been like 5-6 years, she started a small organization where she used to support children who had cancer, and she specifically were looking at children who were below 5 years, right? So, and same, I think, even, Yuvraj Singh has a foundation doing the same. So finding the purpose here, finding purpose in adversity is something that can, just change the entire narrative. So some of the practical tips, I'll not spend too much time, I think most of us know about it, is to accept and still be grateful about the fact that, you have life, you have support, and you can change what is upcoming. And, there are times when, और ये मैं सबके लिए बोल रही हूँ, it's not specifically to anyone going through cancer, that we all feel that there is a time when हमें सबसे lowest feel होता है अपनी लाइफ में, right? और हमें लगता है हम किस चीज के लिए ग्रेटफुल हो, हमारे पास तो कुछ भी नहीं है. वी कीप सीइंग अदर पीपल एंड वी स्टार्ट कंपेयरिंग, अरे उसके पास मेरे से बेटर है यार, काश मेरी लाइफ वैसी होती. हाउएवर, जब भी हम ये थॉट में आ जाते हैं, दैट इज व्हेन वी गेट इनटू द विक्टिम माइंडसेट और वी गेट इनटू अ फिक्स्ड माइंडसेट, एंड दैट इज एग्जैक्टली व्हाट आई एम टॉकिंग अबाउट, दैट वी नीड टू इवन देन फाइट विद आवर ओन माइंड एंड से दैट नहीं, कुछ भी हो जाए, दो चीजें तो ग्रेटफुल होने के लिए होंगी मेरी लाइफ में, इफ नथिंग एल्स इज देयर, राइट? सो थिंक अबाउट दोज टू थिंग्स and we need to maintain that attitude of gratitude. It is a very good way of keeping patients a little busy and a little, where they feel a little fulfilled if they are able to pursue some hobbies and look at creative expressions. Journaling is usually a thing that works in all the phases wherein you are feeling extremely low, because it helps you kind of put your thoughts, which are very messy, into and articulate your thoughts into well articulated words, and then you understand that okay, maybe it's looking really bad, but maybe there are 3 things that I can do what I have written with. Because once you write down the problem, once you understand the problem, once you articulate the problem, finding solution becomes a bit easier. This thing I keep saying, usually what we see is, and this is for both, I would say, cancer warriors as well as the caregivers, that we usually overload ourselves with a lot of information. We want to read everything. अगर एक डायग्नोसिस है, हम सब कुछ पढ़ना चाहते हैं, क्योंकि गूगल इतना इजीली अवेलेबल है, अब चैट जीपीटी इतना इजीली अवेलेबल है, हम हर चीज पढ़ना चाहते हैं. बट आई थिंक आफ्टर यू हैव डन योर रिसर्च, स्टॉप. I'm not saying कि कुछ मत पढ़ो. Of course, you need to be well read about your diagnosis. But once you are satisfied with what you know, your knowledge, please stop going too much into it, because it will not really be helpful to your mind. Practice mindfulness, meditation, spiritual practices also. Spiritual practices से मेरा मतलब है, meditation. If you believe in some God, if you have some faith on some, on anyone, just follow that path as well, because that path would eventually give you a lot of peace. Stay connected with your loved ones. Physical activity is still whatever the body permits, whatever is allowed by the medical team should be done. Small and achievable goals. And this is, you can relate with what I was talking about earlier about the purpose, right? That we need to have a purpose. We need to, maybe find our voice and purpose, and as I said, कि वो एक दिन में नहीं होगा, right? It will be a journey, and you will have your own individual journey, but it can be started by setting small and achievable goals. And lastly, this is a question that I think all of us should ask ourselves. How many times do we laugh in a day? When we were kids, we used to laugh more than 400 times. And if I ask most of you, and just answer it for yourself, right, it would be hardly 10 or 12. And कुछ लोग उससे भी नीचे बोलेंगे, कुछ लोग बोलेंगे अगर आप एक्चुअली याद करोगे, क्या सुबह से आज आप एक बार भी खुल के हंसे हैं? And you will see 80 to 90% people will say नहीं हंसते. And that is where, laughter, humor, relaxation techniques, they may not be able to cure cancer. Of course, they can't. But what they do, they support your journey towards healing. As, I think the whole conclave means the same thing. And, we are all talking about holistic practices. So this is also one of an important elements where you're trying to keep your mental health in a way which supports your physical therapies, which support your medication, or which support anything else that you're wanting to do along with it. Now, quickly coming to the emotional wellness support by the caregiver. So what do we expect the caregivers to do? And I'm sure caregivers are doing much, much, much more than this. This is just a very, I would say, superficial thing that I have written here. But what are we expecting our caregivers to do? So first and foremost, what is important, usually क्या होता है कि जो caregivers होते हैं, they have a lot of pressure, right? If they are in the hospitals, आप देखेंगे उनके पास बहुत सारे कई बार relatives आ रहे हैं, they are managing, the person's entire treatment, they are talking to the medical team, they are also coordinating with a lot of things happening. So they are physically present. But what happens? If you ask a cancer patient, they say, I wish this person was also emotionally present with me. And they don't blame the caregivers. They acknowledge that you are doing a lot for them as a caregiver. But what happens? They want that emotional connect. They want someone to validate their feelings and experiences. And that is an important step that a caregiver should try and take. Another thing that can be done is, as a caregiver, you are very close to the patient. So it is important that you keep reminding the patient that it's okay, you know, take some breaks, let's watch a movie together, let's have some fun time together, just make them feel a bit normal, you know, just it's not necessary to keep talking about it all the time. It would not probably help that much, but feeling that okay, it's a life and it's a part of it, right? It's not the entire thing, it's not the end. I think believing that in your mind and then implementing it out in your actions is super helpful. And lastly, empowerment and advocacy. I'm sure everyone, every caregiver would be doing it and they would want to do it, right? Now, this is about what caregivers should do. But another very important question that comes on all of us, I would say, as a community, as a society, is how can we support the caregivers? How can we give them emotional care? So what the caregiver, now I'm talking about the caregiver mindset, what they are dealing with, what is the stress that they actually deal with is the first and the foremost stress that we have often seen, even, you know, when we end up counseling the caregivers in family group session counselings, is that they say that I don't know how to manage the fear of this patient. I don't know how to manage the fear of my mother, brother, whoever is the person who's suffering from cancer. I don't know, because the fear gets over the board, right? And which is true, which is palpable, which is too much. So that is the biggest stress, that they feel helpless. They feel शायद मैं enough नहीं हूँ, शायद मैं कुछ भी नहीं कर पा रहा हूँ. And that helplessness actually adds a lot of stress and anxiety for the caregiver as well. Secondly, the volatility of relationships, where they feel that पता नहीं यार कब किसके साथ relation strain हो रहा है. Sometimes, you know, they are not getting enough support. Sometimes, you know, the expectations of the relatives are not, you know, are going in different directions, and they just feel very, you know, very tangled in that whole web of being a caregiver. They are also managing finances, and they eventually start feeling isolated because all their time and commitment goes towards the caregiving, and maybe not able to, right, go out, meet their friends, or whatever social activities they were earlier doing, they're not able to do at times. And lastly, and this is something that we usually hear from young caregivers rather than a little old caregivers. By old, I mean middle-aged caregivers here, is the lack of choice. And this is actually a little unfortunate also. But then, you know, in counseling, again, as I said, we talk about changing mindsets, we talk about doing therapies, and, you know, talking about different aspects of their life is a lack. So what they say is the lack of choice. They say that, you know, I'm not a caregiver out of choice. I'm a caregiver because there is no other option. So when that happens, it actually hits the caregivers, and all of that can lead to immense amount of stress, anxiety, and sometimes, you know, depression as well. So what can we tell the caregivers, or how can we support the caregivers, is to keep telling them, please practice self-care. It is important for the caregivers to set realistic expectations from themselves. They may not be able to be a caregiver 24/7. They also need some breaks. So they need to set realistic expectations. A support system, a healthy support system is very important. And I think I've seen that the caregivers who have a good support system, be it from family, be it from friends, or be it from communities, support groups, I think they are the ones who are able to do the caregiving in a much better way. They also need to communicate openly with the patient if they are feeling that they are not able to handle something. They don't have to, you know, hide their feelings. They often feel that, okay, let me mask my feelings. Let me not share what I'm feeling with the patient because they are already going through so much. But what we have seen usually during therapies is that that approach doesn't work. Open communication, no matter how hard it is, maybe you need to time it correctly, but the open communication cannot be, you know, delayed endlessly. Establishing a routine is extremely important. They need to manage their emotions very well. They need to have someone to talk to. And if they don't have, then we at the end say, go for counseling, go for therapy. They need to educate themselves, but they also need to accept support from professionals. We've also seen that sometimes caregivers feel that they can do much more than what they can actually do, right? So in those cases, it is important that they be open to the support coming from the doctors, the support coming from the nutritionists, or anyone else who's supporting you in this journey. Be flexible. It is so important for them to adapt. It is so important for them to delegate responsibility. We've also seen people saying, nahi, main iske saath hi rahunga, और मैं पूरे जितने दिन ये मेरा बच्चा या जो भी है हॉस्पिटल में है मैं साथ ही रहना चाहता हूँ, आई विल नॉट गो. That will eventually affect them and they don't realize it. I will completely understand this is out of sheer love, but it's not helpful physically, mentally for them, right? Rather set a routine. थोड़ा सा अगर आप 2 घंटा बीच में बाहर जा पा रहे हैं, वापस आ पा रहे हैं, that is not a bad thing. We can go ahead and do it. And it is also important to keep encouraging the patient to stay involved. Now, to stay involved in what? As I said, patients usually feel that they have no role to play. उनको ये लगता है हमारी लाइफ में अब हम कुछ नहीं कर सकते हैं. एवरीबडी एल्स इज डिक्टेटिंग व्हाट, मेरा मेडिसिन क्या होगा, मेरी थेरेपी क्या होगी, क्या मेरे को मेडिकली क्या कराना है. बट इट इज सो इम्पॉर्टेंट फॉर द पेशेंट टू बी एन एक्टिव पार्टिसिपेंट of their healing process. They need to be involved. They also need to take some responsibility, right? So you can just tell them, for an instance, कि ठीक है आपको सुबह 10 minutes meditation करनी है, मैं अलार्म लगा के जा रहा हूँ, आप अपने आप सुबह उठ के मेडिटेट कर लीजिएगा, right? Something as basic as that, I think is very, very important. Apart from that, I would just say that being mindful, thinking about future में क्या हो जाएगा, it may or may not happen. Ultimately, that is why it is future, right? We really don't know कि क्या होगा future में. So staying on the present, seeking mental health counseling wherever you feel that nobody else is able to help you, या आपको अगर कुछ इस तरह के signs अपने आप में दिखने लग जाए कि आप बहुत ज्यादा आपको लग रहा है आप स्ट्रेस में हो, कुछ बेसिक साइंस क्या होंगे, आपका वेट थोड़ा सा कम हो जाएगा, आपकी एपेटाइट कम हो जाती है, राइट, या बहुत ज्यादा बढ़ जाती है, आपकी स्लीप डिस्टर्बेंसेस होने शुरू हो जाते हैं, आप बिहेवियरली थोड़ा अग्रेसिव हो रहे हैं या बिल्कुल ही रिक्लूज हो गए हैं. अगर आपको इस तरह के कुछ बेसिक चेंजेस, विच आई थिंक बाय द एंड ऑफ कोविड नाउ वी एवरीवन नोस कि मेंटल हेल्थ क्या चेंजेस होती हैं जो हमें ट्रिगर पॉइंट्स हैं जिसके बाद शायद वी नो दैट नाउ वी नीड हेल्प. इफ यू फील दैट दे आर हैपनिंग, इट इज सो important to go and speak to either a counseling psychologist or, as I mentioned in the beginning of the session, even a psycho-oncologist. They would usually go and do therapies like CBT, cognitive behavioral therapy. Sometimes even NLP works, right, which is neuro-linguistic programming. So all of these therapies clubbed together might really be effective. Now, as I said, I'm going to be talking about the support groups, why support groups are so important. And, as a psychologist, I always vouch for a support group. Because in a support group, you feel that there is an emotional support and reassurance. Having a person who has gone through a similar experience always helps. There is a space that is created in a support group which is non-judgmental. So, आप अपनी बात, अपनी feelings, अपनी experiences खुल के सामने रख सकते हैं and eventually थोड़ा light महसूस करते हैं. Another important factor is that वहां पे जो लोग हैं, क्योंकि वो similar experiences से गुजरे हैं, they can also give you a lot of practical advice, assistance, resources, information. They understand you. उनको समझ आ रहा है कि आप burnout में जा रहे हो, या आपको that you're feeling really, really burned out, या you don't know what to go ahead. So एक तरह से, and sometimes what happens in those support groups is that, people come and talk about, we are cancer free now. So the good news. So you get to celebrate that good news. आपको वहाँ पे hope भी मिलती है, वहाँ पे आपको motivation भी मिलती है. You feel resilient and, sometimes you feel like यार ये इंसान कर सकता है तो शायद हम भी कर सकते हैं. That hope, that human connect, जो कहीं ना कहीं हम social isolation में देखते हैं कि कहीं cancer patients या cancer caregivers जाते हैं. Support group आपको उन सभी चीजों से मुझे लगता है अच्छे से prevent करता है, बचाता है, और आपको मेंटली थोड़ा स्ट्रॉन्ग बनाता है कि आप उस सिचुएशन से आप अपनी बेस्ट पॉसिबल वे में डील कर सकें. This I really don't think I should be talking about here because there are such great doctors on this platform, but I still, because it's a part of the slide, I would just go through it. Of course, I'm sure all the doctors are doing much, much more than what I have written here. But I just, as a counselor, what I've seen is that अगर ये 3 points होते हैं, right, in any of the care that medical professionals give, I think the patients feel more confident in the way the treatment goes, and we've seen that treatment outcomes usually better होते हैं, which is psychoeducation, explaining, wherever you see a doctor sitting with you and explaining you the diagnosis. Because as a lay person, even I mean, अगर हम कुछ भी, आप किसी भी illness की बात करें, अगर हमें वो illness हो रही है, हमें नहीं पता क्यों हो रही है, we want to go to the doctor and ask 20 questions about it. And if the doctor is patient enough and talking about that, right, कि अच्छा ये reasons हो सकते हैं, अब आपको आगे ऐसे करना है, इसके बाद ये जर्नी रहेगी, अगर वो आपको आपकी एक जर्नी की ग्लिम्स दे देते हैं, I think people feel a little more prepared and a little confident. उनको hope मिलती है कि yes, there is a good future ahead. Then Trust building is super, super important with the doctor and the patient, as well as the caregivers and any other stakeholders. And lastly, offering some resources, and the resources could include, you know, we actually get so many referrals wherein the doctors are referring saying कि इस patient को I think therapy में जाना चाहिए, या इस patient को हमें support group में भेजना है, या अगर हम कुछ mindfulness sessions करा रहे हैं, meditations करा रहे हैं, they would just say कि ठीक है therapy नहीं करनी है इनको, पर ठीक है आप mindfulness sessions के लिए भेज दीजिए. So anything of that sort, as you know, we are trying to create a web of holistic healthcare. I think that is a part of it. And lastly, a question that I have heard a lot many times: can my mind cause cancer? Can my mind cause cancer? Right now, the answer is your mind. Technically, it's intangible, right? Mind to intangible है, हम तो brain, ये तो brain है, right? Mind cannot cause cancer. The answer is very simple. The answer is no. However, हम लोग देखते हैं कई बार थेरेपीज में that we actually deal with you know clients who say हमें कैंसर एंजाइटी है, या हमें उसको हम कार्सिनोफोबिया भी बोलते हैं, because it is been talked so widely. Sometimes it also, you know, there are some patients जो बहुत anxious हो जाते हैं ये सुन के, they would keep checking for their symptoms, they'll keep checking for the body. तो ये क्या चीज है? ये एंजाइटी भी है, ये आपका स्ट्रेस भी है. और एक हम चीज और यहाँ बात करते हैं विच इज द टाइप सी पर्सनालिटी. और ये भी मुझसे बहुत लोग आके क्वेश्चन पूछते हैं कि क्या टाइप सी पर्सनालिटी थी क्या मेरी, क्या मैं इस वजह से, क्या मुझे हुआ कैंसर? अगेन द आंसर वुड बी नहीं, वी कांट से. सो व्हाट इज द टाइप सी पर्सनालिटी? द टाइप सी पर्सनालिटी इज, the C stands for being over conscientious or over cooperative, right? कुछ ऐसे लोग, हमारी कुछ इस तरह की एक माइंडसेट रहती है, और वो शायद बचपन में बनती है, where we start suppressing our emotions. हम अपनी बात खुल के सामने नहीं रखना चाहते, हम अपने से ऊपर दूसरों को रखते हैं. We are more sacrificing by nature, which is not bad if it's happening in a limit, right? It goes beyond limit, and it becomes a chronic emotional suppression. The case of a chronic emotional suppression. Now, it doesn't cause cancer. I wouldn't say that it causes cancer, but what it can actually cause is your weakened immune system. आपका immune system weaken होता है, और आपके जो cortisol levels हैं वो chronically high रहते हैं. आप हमेशा stress में हो, आप देखोगे आप हमेशा anxiety में हो. That I would say is not good. It's not good, and I'm not saying that it causes cancer, but it can somehow progress it, or it could just be a detriment in your journey towards healing, right? So I think that is a very important point. And I would also want to just say one small thing here. And stress पे भी हम बहुत बार लोग आगे से आगे ये भी पूछते हैं कि stress में तो हर कोई है, हर इंसान स्ट्रेस में रह रहा है, तो मेरे साथ ऐसा क्यों हो गया, सामने वाले के साथ क्यों नहीं हो रहा, उसको देखिए वो ज्यादा स्ट्रेस में है. सो उसका भी एक साइकोलॉजिकली हम एक थ्योरी की बात करते हैं विच इज कॉल्ड एज अ स्ट्रेस डायथीसिस मॉडल, जिसमें हम ये बोलते हैं कि कुछ ऐसे लोग होते हैं जिनके अंदर एक ट्रिगर प्रेजेंट होता है. आप देखेंगे कोविड में कितने लोगों को स्ट्रेस एंजाइटी बहुत ज्यादा हुई, और कुछ लोग बिल्कुल नॉर्मल रहे थे. सो उसको भी अगर आप रिलेट करोगे तो जिसके अंदर वो ट्रिगर है, वो क्या ट्रिगर होगा? वो एक जेनेटिक ट्रिगर भी हो सकता है, वो कोई थॉट का ट्रिगर हो सकता है, कुछ आपके सबकॉन्शियस माइंड का ट्रिगर हो सकता है. इफ दैट ट्रिगर इज प्रेजेंट, और बाहर से आपको कोई बहुत मेजर स्ट्रेस आता है, यू कैन गेट ट्रिगर्ड, right? That is what the stress diathesis model say. We don't know whether who has that trigger or not. So वो भी एक conflicting situation बन जाती है. But my only suggestion towards the end is that हमें बहुत important है कि हमें पता हो कि हम emotionally क्या feel कर रहे हैं. हर वक्त अच्छा feel नहीं करेंगे, but the sheer awareness of my emotions is very critical. अपनी feelings को, अपने emotions को मत दबाइए. That is the worst thing that you are doing to your body, your mind. There is a book, it's a very nice book, it's known as it's called the mind forgets, the body keeps a score. It's called the body keeps a score, which means कि आपका दिमाग शायद भूल जाएगा, आपका माइंड भूल जाएगा आपने एक स्ट्रेस लिया, लेकिन your body will remember, your body will store that stress somewhere overall, right? So we keep talking about that. As I said, प्लीज नेगेटिव इमोशंस के लिए एक आउटलेट दीजिए, चाहे वो थेरेपी हो, चाहे जर्नलिंग हो, चाहे इमोशनल वेलबींग का कोई भी तरीका हो, चाहे स्पिरिचुअल प्रैक्टिसेस हो. ये याद रखिए कि बॉडी और माइंड कनेक्टेड है, एंड इफ वी रियली वांट टू हील cancer or any other critical illness, it is so important that your mind should support the body's healing. So that is the message that I want to leave you up with. Thank you very much.
Dr. Kanksha Bhatia, thank you so much for covering all aspects of cancer. And I would like to share over here that the mind-body connection is very deep. And I'm so glad you shared the name of that book, that the body keeps the score, because I have personally seen that people who have a severe reaction, I'll give you a couple of examples. We know of somebody amongst the clients about 10 years back whose son refused to join medical college, and the whole family was of doctors. And the mother couldn't take this, and for 1 year she had severe arthritis, and the blood tests and all were hard. They were no really, they could not find much in the blood test really. So, and we also know that whenever there is a severe resentment, anger issues, or bottled up emotions, which are somewhere they're getting stored, and obviously medical science has not progressed enough to know where we are storing those bottled up emotions, and I'm sure at some point that will also come out. But this mind-body connection, which you have explained so beautifully, thank you so much for this. And I'm sure that today a lot of people would have got a different perspective about illness, because normally people think mind is separate, body is separate, disease is separate, organ is separate, food is separate. So today we are trying to bring everything together to help you understand. And now we are open to questions. So Kanika, can you please take the questions? Regarding Mr. Suresh Lala, I would like to tell you that tomorrow we have a wonderful session on breathing. And I would request everybody who's coming in today, please do attend that session on breathing, because Yogacharya Manishji will be telling you amazing facts about breath work and disease. So so breathing and how your cells need to get oxygenated, why breathing is important, all that we'll discuss tomorrow. So please do attend that session. In the meanwhile, we are open for questions.
Sure, ma'am. So I would like to first read out Miss Anubha's question. That she's saying that she's a blood cancer survivor. Her age is 29 years old and she was diagnosed cancer 4.5 years back. She has two main questions. The first one is that what is the right way to consume turmeric, black pepper, tulsi, and other such herbs, because these products also cause liver inflammation. And her second question is that why is it gym versus yoga? Why can't it be both? As gym helps in building stamina and healthy muscles and bone strength, while yoga helps us in regulation of hormones, energies, and immunity.
Yes. So the second question, I think I would really love if you can come tomorrow. And also Dr. Seema Puri, if she would like to answer some of the questions. And tomorrow also we have wonderful panelists. We have Dr. Shiv Harti. He's from the All India Institute of Ayurveda, and he will be shedding more light. But Dr. Seema Puri, would you like to give your opinion on this question?
Yeah, it was what, turmeric and...
It's turmeric, black pepper, tulsi, and other such herbs.
Okay, so I think Dr. Shikha, with the Ayurvedic background, you would know better. But what I understand is that having these in a limited amount in the diet is fine, because diet is self-limiting. You cannot have excess. And secondly, what I've learned from you people also is that in Ayurveda, you say that you give it for 3 months and then you take a little break if they're having it as a supplement, because some of these herbs and spices are hepatotoxic. And therefore, one should not have a continued use. Second thing is that most of them contain these phytochemicals which are destroyed on heating. And therefore, if you're boiling water and you're making, putting it in and boiling it along with the water, many of these helpful constituents will be destroyed. So it's better to have it when you are just sprinkling it on top or doing minimal processing to the food. Is that correct? I'm sure you can add to it, Shikha.
So, Dr. Seema Puri, in fact, tomorrow we would be having Dr. Shiv Harti, who's an expert, and so we'll again put these questions and to throw a different light. But like Dr. Seema Puri said, that none of these are like magic pills. You cannot have it like a magic pill and think that I'm sorted, and the other changes like the exercise, the yoga, the mindfulness, all of them have to come together. The most important thing I'd like to highlight over here is, please be very careful with the brands you are using. because ultimately any herb, how it has been handled, whether it's been grown organically, how it has been put together, that is very critical. And if that has been done right, you'll get the benefits. But if that has not been done right, then the benefits will not come. And of course, if they have been grown with the pesticide and chemicals, then there'll be no benefits. There might be harm. So those things are important. We hear a lot about arsenic and mercury and all that. So the reason is that it depends a lot on the manufacturer, how they are handling the herb, how clean is the environment, what is the kind of water they are using. And that is why trusted brands are very, very important when you're consuming these things, especially plant-based things. And tomorrow we'll be shedding a lot of light on that also with the experts. So please do join in tomorrow also. Dr. Seema, for you, I think I have a question which is very, which keeps coming back to my mind again and again. That, like you mentioned, that during the pandemic, India did not have that kind of a death rate as in the West they had. So could you talk a little bit about why diversity is so important? Like, these days, if I see in the big cities, most people and maybe the teenagers are having a very limited diet in terms of the raw material. So can you share a little bit about why diversity is so important? Why should people bother to even have different things in their diet? Dr. Seema, you're on mute.
Yes, sorry. So actually, every food contains a different set of nutrients in different proportions. And also, more than the nutrients, it's the phytochemicals, which are non-nutrient substances which have health benefits. And therefore, it's, I would say, a variety in everything. So diversity, even in the type of oil you're consuming. So while some of it could be vegetable oil, and these are very traditional practices. Traditionally, we would cook some vegetables in mustard oil, some in cooking oil. You would put ghee in the dal that is being made at home or on the chapati. We would put milai on something else. So there was a variety of fats being consumed. Similarly, variety of cereals. There would be bajra, there would be rice, there would be wheat, there would be, depending on the location where what is grown there. Similarly with fruits and vegetables. And somewhere down the line, with all the processing that came up, we have lost that diversity. And therefore, the kind of phytonutrients or the kind of beneficial compounds we're getting from the diet has become very restricted. And I'd also like to put a fact here is that, something that we should all think about. We are all very enamored with, shining apples, which have come from California, and we go and buy fruits which are so expensive, which are wax coated, processed, etc. And we are forgetting the traditional fruits and vegetables. So, which used to grow in our backyard, something like the jamun or the shatut. I mean, we don't see those nowadays. We go and buy blueberries at 250 rupees for 100 grams. And we've forgotten these humble, cheap fruits, which are much more nutritious. So even green leafy vegetables, if you go to villages today and you talk, even still, they are using the leaves of everything they grow, whether it is chane ka saag, whether it is mooli, whether it is gajar, they use all of them. And somehow we have lost that diversity, which was traditionally very inherent in our diet. And, inherently, we used to use vegetables which were seasonal, which were local, and use all parts of the plant in some form or the other. Even pea shells were being used to make a sabzi. I think that is a message which we really need to revive, because today's children only totally westernize only potatoes. When I ask the first class that I have in my college, I ask the students, name 5 different vegetables you had yesterday. They can't go beyond 2 or 3, which is very unfortunate. So it's very important.
Absolutely true. Absolutely. I couldn't agree more. In fact, yesterday I met somebody who has shared an amazing story. A story where their son lost 60 kilos over a period of time. And I was very curious, because we are in this profession, that what plan did he follow? And, the father was very amused. He said, what he did? He just stopped Zomato and Swiggy.
Yes.
Those apps. So imagine that, what we are not even realizing, that how these things are coming in our lifestyle, and how outside food is becoming a daily food. So
Yes.
some of these things we are going to touch upon tomorrow also. Kanika, any more questions?
Yes, we have one more question.
Yes.
This is by Miss Amrita Zawar. Please clarify about gluten-free diet and dairy-free diet. Is it scientifically proven as line of diet for cancer patients?
Dr. Seema Puri?
I don't think so. I think you have a session tomorrow by Alka, who's going to talk more about the diet. But unless there is a detected allergy or intolerance to milk or gluten, it's not really recommended. Like wheat is considered to be a superfood, whole cereals. So unless there is a particular issue, intolerance, I don't think it's really desirable.
Yes. And so tomorrow I would just like to introduce that for tomorrow's session, we have Dr. Ravi Gaur, and Dr. Ravi Gaur has spent almost 30 years as a doctor in the pathology field. And he is an expert on all the possible tests which are there for every type of cancer. He's spent all his years in the pathology. Then we have Dr. Shiv Hardi. He's a professor, a very senior professor at All India Institute of Ayurveda. Then we have Dr. Reena Rawat, who will be talking about naturopathy and Ayurveda in a holistic way. Then we have Dr. Alka Mohan, and Dr. Alka Mohan has retired from All India Institute of Medicine, AIMS, All India Institute of Medical Sciences, and she's a nutritionist. She used to be the chief dietitian there. And then we have Yogacharya Manish, who will be talking about breathing. So please do come for tomorrow's session also. And for today's session, we'll be sharing this video on YouTube. So some of your friends who have not watched it or would like to watch it, we'll share the link with you, or you can invite them. And at the end of tomorrow's session, we'll be sharing some highlights of today's session of the speakers. And also, in case you want to reach out to any of the speakers, please let us know, and we'll be happy to connect you to the speakers. So with that, I think, Kanika, if there are no more questions, then we would like to thank our panelists.
Yes, ma'am. I would like to call upon Bhavna ma'am now for the vote of thanks for the day one.
Thank you, Kanika. Very healthy afternoon to everyone. I think it's my great privilege to deliver the vote of thanks for all the distinguished speakers today. So first and foremost, I would like to thank our distinguished speakers, Dr. Gurdeep Sethi, Dr. Anshuman, Dr. Seema Puri, Dr. Akansha Bhatia. And it was really an enriching experience, and your insights and expertise had really deepened our understanding regarding the subject. Thank you for that. And of course, after that, I would like to thank Dr. Shikha, because without her vision, without her vision of bringing all the sciences together, this conclave would not have been possible. So thank you, ma'am, for bringing all the sciences in this conclave. And yes, I would like to thank Kanika, because she has been working tirelessly behind the scene to make this happen, to make this conclave happen. Thank you, Kanika, for your contribution. And last but not the least, all the participants, each and everyone, thanks for showing up, and thanks for becoming a part of the community who will become a part of the awareness group, because this thing is very important. When you become aware about something, you are going to spread this knowledge. And as ma'am said, that tomorrow also we are going to have a session that would definitely be again a very insightful and expert session by all our distinguished speakers. So I would request everyone to be a part of tomorrow's session as well. And thank you so much for joining us. Thank you so much.